and he is in Washington, D.C. Wonderful. Dr. Wetzel, are you able to check your audio real quick?
Yes, can you hear me?
Yes, we can. Thank you. I'm going to go ahead and share our screen over so that you can share your screen if you have a slide point. But welcome, and we just did your bio. I think I had you muted or for a second there. But welcome, and we are applauding now.
Hi, everyone. Can you guys see my screen okay? Yes. Okay, perfect. I guess the introduction was already done. So just my name's Corey. I'm with APhA, one of the fellows there, working with the government affairs and professional affairs teams. And this evening, I'm just going to talk about the importance of pharmacy advocacy as well as share some national legislative updates from here in Washington, D.C. So first, just looking at the agenda, I want to start with the importance of advocacy before getting into those national updates, and then we'll end with some ways in which you can get involved in advocacy efforts. So jumping right into the importance of advocacy, I first wanted to define what advocacy is. So Merriam-Webster's dictionary defines it as the act or process of supporting a cause or proposal. So you might think of actions like attending marches, organizing rallies, sending letters to your elected officials, voicing your opinion, but being an advocate can take so many different forms. And that's kind of what I wanted to highlight here towards the end of the presentation as well. So first, and I know this might be a little difficult, and maybe you guys can just talk amongst yourself, but I wanted to ask what causes are important to you? I'll give you a second. I think I can see some people in the classroom. You guys can share those with each other, and then I'll kind of dive into some that we thought that we would share with you.
We have some speakers in the room that would like the microphone.
Oh,
Here we
perfect.
are.
Access to healthcare, it's one.
That's a great example.
Another one.
Adequate pharmacy reimbursement.
Yes, that's a huge one.
Oh,
Okay.
we have another one. Hold on.
Oh,
I'm going to run
okay,
across the floor
perfect.
with some heels. Hold on.
Protecting the 340B drug pricing program.
Yes, those are all very important causes dealing with pharmacy. Some of the ones that I was going to talk about tonight are pharmacist burnout, pharmacy closures, expanded scope of practice, payment for pharmacist provided services, and then PBM reform. So jumping right into it, looking at pharmacist burnout. So currently, more than 50% of health system pharmacists and approximately 75% of community pharmacists have reported that they have experienced burnout. Additionally, 20% of graduating student pharmacists say they would not choose pharmacy again if they were to start their career over. So these are huge issues for the profession. And pharmacy burnout leads to not just pharmacists being stressed out and mental health issues of those within the profession. It can lead to medication errors, outcomes, poor quality health outcomes, and it can also contribute to the pharmacist shortage as people are leaving the profession. Next, I wanted to talk about pharmacy closures. So pharmacy closures, again, a huge issue. The pictures here highlight the interactive map that Dr. Barenbrock from the University of Pittsburgh created that tracks pharmacy closures across the United States. I've also included one close-up of the state of Utah. So you can kind of see kind of where the pharmacy closures are throughout your state there. And then some studies that have been done recently have found that almost a third of all pharmacies in the United States have closed since 2010. So pharmacies are closing for multiple reasons, but one of the big ones is pharmacy reimbursement rates, which someone highlighted. Those continue to decline while operational costs continue to increase, making it harder and harder for stores to remain open, which is why advocates of the profession are pushing for higher reimbursement rates for pharmacists to be able to bill for services, which kind of takes us on to the next cause that I wanted to highlight, looking at the expanding the scope of practice of pharmacists. So when we look at expanding the scope of practice of pharmacists, this is a top priority, as I mentioned, of many pharmacy advocates, because not only does it allow for pharmacists to practice kind of at the top of their license, it can hopefully kind of fill some of those gaps to help pharmacies recuperate some of that money that they are kind of losing when it comes to those lower reimbursement rates. So a pharmacist's scope of practice is really just the services that they're authorized to perform as part of their professional license. And we are seeing great strides in the pharmacist's ability to prescribe all sorts of medications at the state level, some that I kind of just pinpointed here to highlight. We continue to see growth in hormonal contraceptive prescribing, the prescribing of HIV, PEP, and PrEP, and with smoking cessation agents. And then looking kind of, I guess I wanted just to share, like looking at the current practice. So a pharmacist's ability to initiate services can be both dependent and independent. So I kind of, this little graph over here kind of shows that, but looking at dependent pharmacist prescribing. So this is through the utilization of CPAs or collaborative practice agreements. So these can either be patient specific or population specific. So patient specific, those are going to focus in on individual patient collaborative practice agreements, where it's between, well, the collaborative practice agreement, we'll go through those later, but for patient specific, going to be specific to an individual patient, while population specific is focused on those broader categories of patients who may be eligible for a specific type of service. And then when you look towards the other side of the chart here with the arrow, we kind of see the independent pharmacist prescribing. So with that, we have government protocols, which are just government authorizations for pharmacists to prescribe specific medications in specific situations. And then there's the standard of care prescribing, which permits pharmacists to utilize their professional judgment to prescribe medications with a standard of care, or essentially what other pharmacists would do in that same situation. So this is the prescribing method that most closely resembles of what we think of the same mechanism that physicians or other providers are currently using. So as you can kind of see there at the bottom of that graphic, on the one side, the patient-specific collaborative practice agreements, those are the most restrictive, while this standard of care would be the least restrictive. So as I mentioned, we'll look more at collaborative practice agreements. So looking at those, these really are those formal relationships created between a pharmacist and prescribers. So usually a physician, but in some states, they can be nurse practitioners or physician's assistants collaborating with the pharmacist. So in these collaborative practice agreements, the prescriber delegates certain functions to the pharmacist, and they can either be, as I mentioned earlier, patient-specific or non-patient-specific population, where it is dependent on the specific population of patients or the specific type of intervention. So that's one way. Additionally, we have these statewide protocols. So these are the frameworks which are issued by a state board or agency that permit pharmacists to prescribe a medication or category of medications under a protocol. And then in some states, this does require the pharmacist to complete additional training or a specific continuing education program in order to participate in the prescribing protocol. There are also standing orders. So these lay out specific actions for pharmacists to follow when treating specific conditions. So the pharmacist can carry out the standing orders when predetermined conditions are met. And then the orders are either statewide or they can be created with a specific provider. And then I just wanted to kind of define some of those. And then we'll kind of look at the next issue here, which is the payment for pharmacist provided services. So there really are three avenues in which pharmacists are trying to get paid. So there's Medicare. So advocates here are trying to change federal law to allow pharmacists to get reimbursement for services provided to Medicare beneficiaries. So those are the people that are 65 and older, some people with certain disabilities, or those that have end-stage renal disease. Another way is through Medicaid, with the goal being here to change state law to allow reimbursement for the state's Medicaid beneficiaries, which are those with low incomes or certain disabilities, and then some children. And then lastly, we also have advocates who are trying to change private or commercial insurance to get them to pay pharmacists for their services by changing the internal policies of these organizations that would then allow for reimbursement for services that the pharmacists are providing. So these are 3 ways in which we have people or advocates of the profession trying to ensure that pharmacists are getting paid for all of those services that we are already providing. And then, of course, I wanted to touch on PBMs and PBM reform. So before going more into PBM reform, I just wanted to do an overview of what PBMs or pharmacy benefit managers are. So they really are, they're hired by the third-party plans to do this list of activities. This is a small list of the activities that they do. Process claims, manage formularies, negotiate rebates, operate mail order, the mail order aspect of the pharmacy. All of this in an effort to supposedly save or save patients money or decrease the overall cost of drugs. However, currently 3 PBMs control over 80% of the total market share, and the consolidation of the PBMs as well as the vertical integration has really led to them having significant power and influence that not only have allowed them to dictate drug price, but have also allowed them to dictate which pharmacies patients can go. So they're really altering patient access here as well. So when looking at reform, there are really 3 big areas that advocates are pushing or focusing on. And the first one here being transparency. So by requiring PBMs to report more on their business practices, hopefully we'll be able to better understand some of how they operate so that real reform can be implemented later on. The second one, where really people are focused on limiting their anti-competitive business practices. And the 2 of them that I have mentioned here are patient steering and spread pricing. So patient steering is when PBMs direct patients and their prescriptions to their own pharmacies or retail operations, whether that be mail order, specialty, or brick and mortar stores that they own. Kind of like I mentioned earlier, getting to the point where they're steering them away from maybe their preferred pharmacy to the pharmacy that they own. And then spread pricing, which is the practice where a PBM charges a payer more than they pay a pharmacy for that prescription. And then the PBM is then keeping that price differential as profit. And then the last big area here that I wanted to highlight is affordability. So looking for ways to make drugs more affordable by limiting PBM income and revenue streams. So that kind of moving on now to the national legislation updates. So as many of you know, there was a recent election and the Republicans now control the White House, the Senate, and the House. So in the Senate, the Republicans have a majority with 53 Republicans and 47 Democrats/independents. And then when we go over to the House, we kind of see there are expected to be, it says 219 on here. Eventually, once all of the vacancies of Trump's cabinet members are filled, will be right around that 220 number with the Republicans and 215 Democrats. So kind of slim margins, but still a majority for the Republican Party. And so given that this is a new Congress, we do not have any new bills to report on as of right now, but we do expect ECAPS, or the Equitable Community Access to Pharmacist Services Act, to be introduced or reintroduced at some point in some capacity during this session. So if you're unfamiliar with this bill would allow pharmacists to bill Medicare for the testing of COVID, flu, RSV, strep throat, and the treatment of COVID, flu, RSV, and strep throat, and then vaccinating or vaccines, immunizing for COVID, flu, pneumonia, and Hep B. So during the last conference, or not conference, during the last Congress, sorry, this bill garnered 148 co-sponsors on the House side and 29 on the Senate side. So lots of movement there. Hopefully, we'll see it reintroduced again, kind of see it get through committee. While it did have substantial support in the last Congress, it did not end up passing because it was met with some opposition at one of the committees during the end of the session. And then looking at PBM reform, so several PBM reform provisions were initially included in the end of the year package, including the ones I have kind of highlighted here. But we do expect PBM reform to be reintroduced in probably several different ways. This session, I kind of wanted to highlight some of the ones that were included in this kind of included in the end of the year package that didn't end up passing, but kind of to see maybe where the direction the Congress is headed. When looking at that, so we have preventing spread pricing in Medicaid, assuring pharmacy access and choice for Medicare beneficiaries. This again kind of gets back to that point where patients can kind of choose the pharmacy of their choice. Additionally, increasing transparency by requiring all sorts of reporting requirements is also included. And then one of the other provisions I wanted to highlight was it would require drug rebates and discounts to be fully passed through to the employer or the health plan. So like I mentioned, we expect PBM reform to be introduced in some capacity during this session, and for a lot of attention to be on it, given that a lot of the PBM reform bills last year had bipartisan support. And then kind of the last thing that I kind of wanted to highlight were just some ways to get involved in advocacy efforts. So one of the best ways to start advocating for the profession is by joining professional associations. There are both state and national associations that work towards promoting, protecting, and advancing the pharmacy profession. These associations provide members with opportunities to get involved, keep members updated and informed on legislative and regulatory changes that occur throughout the year, and have a whole host of other member benefits. So like I said, there are several national organizations. Being from APhA, I highlighted APhA here, and then I wanted to highlight the state association as well. And then another easy way to get involved is communicating with your legislators. There are letter writing campaigns both at national and state level. Here I highlight APHA's Advocacy Action Center, and a lot of different, not just pharmacy associations, but advocacy groups utilize these type of letter writing platforms, which allow you to go in and just enter your zip code usually and your name, and they pre-populate kind of a letter that then you're able to send to your congressional or just your legislator. And I will say that I have submitted all of these since I started working here at APhA, and I've gotten responses back on most of them that I've sent. So I always like to remind people that legislators, they represent you, so you should feel comfortable communicating your concerns with them, and it's kind of their job kind of to get back to you on those. Additionally, this photo here, you can always go and make appointments with your state or federal legislators to talk to them about issues that are important to you. And this is just a photo of me with some students from the University of Maryland with one of the staffers on Capitol Hill. And with that in mind, I just wanted to highlight Utah's U.S. senators. So we have Senator Curtis and Senator Lee. And then moving on to Utah's members of the United States House of Representatives from the 1st District, there's Blake Moore. Celeste Malloy from the 2nd District, Mike Kennedy from the 3rd, and then Burgess Owens from the 4th District. I always think it's good to just know who represents you. So that was kind of the point of highlighting those members here. And then additionally, you can find your state representatives by going to the House and Senate rosters and kind of looking up either district or by zip code. So those are kind of easy to locate. I didn't want to include all of them on there as I was not sure who was in the room or where everyone was from. Some other ways to get involved that I kind of wanted to highlight. So you can contribute to pro-pharmacy PACs, and kind of what a PAC is PACs are just ways for people, members, to kind of pool their money together to support campaigns of legislators who share those same beliefs in an effort to influence policy. The reason I included this one on here as kind of within the presentation is that APHA's Back the Pack campaign, which is the yearly competition of APHA ASP chapters, starts next week. So you kind of get a little foreshadowing of some of the communications of what's to come from APHA. But that's another way to kind of get involved in advocacy efforts. Additionally, I just wanted to kind of list some other ways, and put some photos here. So while I was in pharmacy school, I was able to record a podcast for our state's pharmacy association talking about pharmacy advocacy. We also were able to obtain a mayoral proclamation, kind of recognizing the day where we had the students at the state legislature as West Virginia Student Pharmacist Day. So there's several ways that you can get involved in advocating for the profession. And there's really no right or wrong way to do it. And you just never know what involvement might have a significant impact on getting a key piece of legislation passed or getting a key legislator to notice your cause or your campaign. And then with that, I just have a quick summary of the presentation. So there are fundamental opportunities for improvement in the healthcare system that utilize pharmacists and allow pharmacists to practice at the top of their license. Securing payment for pharmacists provided services and reforming PBMs are top priorities for many pharmacy advocates. And then as students, you guys are really in a unique position to advocate for the change that you want to see in the profession. Not only do legislators love meeting people from their home districts, they love meeting young people that are involved in the policy process. So as I said, this is a great or a unique position to be in. Additionally, advocating on behalf of the profession can take many different forms, and I hope I kind of highlighted some of those towards the end of the presentation. But often a lot of these start with joining a state or national pharmacy association. So I would highly recommend that all of you find the association that you feel most comfortable with and kind of seek out joining those for all the opportunities and member benefits that they provide. And with that, I can take questions. I know you guys are on a tight schedule. My email is here. Feel free to take a photo, or if you have any questions, feel free to contact me and I will get back to you.
Thank you so much. Do we have any questions? Any questions? It's a great presentation. I really enjoyed how you went into the details of PBM reform and where our progress was and hopefully where we're going in the future. I know our students in the room, we have our Capitol Hill Day coming up, and I believe we have one poster at least dedicated to PBM reform. So hopefully those students that are participating on that poster are in the room and taking great notes so they can share with our state members of the legislature. So thank you so much for taking 30 minutes out of your busy schedule. And I don't think we have any questions. No questions.
Thank you guys for having me. I would just also like to note that this calendar that you guys have set up is amazing. As a student that was very involved and really enjoyed advocacy, props to your professors and anyone that was involved in creating this because this is a great opportunity for you all. So take advantage while you're there.
Thank you so much.
Bye.
Wonderful. So we have just a couple minutes if you wanted to take a quick 5-minute break while we transition to our next speaker. So our speaker can come up and get oriented to the computer. We will start up in another 5 minutes. Right there. All right, we're going to move on to our next session. So our first session was a great little introduction about national pharmacy advocacy. Now we are going to transition to Utah legislation updates. And we have Adam Jones here. Adam Jones is the Executive Director of the Utah Pharmacists Association. He is a Utah native and graduate of Utah Valley University in Business Administration. He is an owner of Paradigm Consulting, an association management company that contracts with associations on management and professional services for associations. He has been a registered lobbyist in Utah for over 20 years. He loves the outdoors, hiking, boating, and spending time with his family, including his 4 children and wife. Welcome, Adam.
Thank you very much. Is that on? Can you guys hear me with that, or does it need to be a little louder? We good? All right, perfect. Well, first off, thank you for having me. It was great to also hear from Dr. Wetzel ahead of time as well, too, because he shared some great things from the national side. And I want to focus more a little bit today on just the state side. And you guys are going to have an opportunity to come to the Capitol building here in the next few weeks and share a little bit about what goes on at the Capitol. So we thought we'd share a little bit about how that process works. Maybe talk about a few legislative bills that we have on the state side of things. It obviously works a lot different than on the federal side, and we can talk through some of that as well too. The other thing I don't like to do for this group when I come in here is I don't want to have to put together a PowerPoint presentation. You're going to see enough of that between your classes and over the course of your career when it comes to continuing education. I thought I'd take a little bit of a different approach for that, and we're going to talk through and maybe be a little interactive in regards to some of the resources that are available for you to look at when it comes to advocacy in Utah. As mentioned in my introduction, I have been a registered lobbyist for a little over 20 years. My father was a lobbyist as well before me. He spent 40 years up at the Capitol lobbying, so it's something I've grown up around, been part of. I used to go up to the Capitol on occasions when I was younger with my dad and just hang out, see what the process was. So I've been fairly familiar with it. But once you get into it, there's a lot that goes on with it. We've got Jeff Gatzmeyer here from the Pharmacy Association. He'll be presenting a little bit later. He's our incoming president, also our legislative committee chair as well. And so he spends a lot of time with me, and he gets a lot of phone calls from me when the legislative session starts, of asking questions about different bills and how that may affect him in his pharmacy versus a community chain pharmacy versus independent versus a hospital pharmacy. And we talk through those things. Then we obviously have committee meetings where we talk through a lot of things that go on. But I wanted to maybe talk about more the specifics on the state side. And I wanted to maybe start by introducing the legislative website. Dr. Wetzel in the previous presentation noted that you could find your legislator, whether your state senator or your state representative, on the legislative website. But I wanted to give a little bit more detail about how that works, because this is probably one of the best tools and probably the best legislative website in the country. And I say that with a lot of backing, because the state of Utah has been awarded a number of awards and recognitions for the work that they have done in regards to their legislative website and just their government work that they do. So I wanted to share a little bit about it to start with. So the legislative website is, and I'd encourage you to go there while you're here in this room with me, and we can talk through it as well. It's le.utah.gov. So LE for legislative, le.utah.gov. And when you get to that website, it's going to come up to basically this page. It may look a little bit different depending on whether you're going on your phone, a tablet, or a computer, but the basic ideas are the same. And the first thing I always want to share with people when it comes to the legislative website is knowing who your legislator is. How many of you know who your current legislator is here in Utah? By raise of hands. Anybody know? I won't ask you. I know Jeff does. But anybody else know who their legislator is? Okay. That's a normal response. That's the normal response we usually get when we have these type of meetings. Even in our pharmacy convention and mid-year meetings that we have, the numbers are usually very small as well. So that's normal. But we want to hopefully change that process and make sure that you as students, while you're in school and also when you get out of school and get into wherever you're practicing, know how to get a hold of your legislator. I can at least address that for if you're here in the state of Utah. If you go outside of the state of Utah, you may have to go through a different process. But here in Utah, it's a pretty simple process. So if you go to the legislative website here, there's a few things. There's obviously some menus across the top. We'll go through some of those, but there's also a calendar of things that are happening. Let's see. This is the current calendar. Obviously, it's selected for today's date, and then there's a calendar of things that are going on. This just happens to be showing that the Senate Business and Labor Committee is going on right now. So one of the great things about our legislature is Everything is shared. So if you click into this information, you can actually listen to or view the committee meetings that are going on anytime live, or you can go back and listen to recordings. So because this one is in green here, means that that committee meeting is actually going on right now. The Senate Business and Labor Committee, which happens to be chaired by a pharmacist, Senator Evan Vickers, who will be sharing a little bit later. He's the chair of that committee, which is why he couldn't meet during this time. He's chairing this committee and running it. Yeah, you can go in there and you can see what's going on. You can look at the calendars. But I wanted to come down here to this little link here. It's typically when you come onto the page, it has this quick links. But if you click the Find Your Legislator option, you can actually put in your address. I've already put my address in. If you want to know where I live at, that's where I live at. I'm openly sharing that. Don't come and toilet paper my house or send anybody after me. But anyway, so these are the people that represent me in my area. Senator Dan McKay, he's been up there for quite a number of years at the Capitol, and then Representative Doug UPhA. He's a brand new legislator. This is his very first session. He's working on day 2 of the legislative session now. That's his experience in there. He comes from the construction background side of things. Everybody at the legislature comes from different backgrounds. A lot of times people think, well, they're probably all attorneys. They're all like career politicians. That's not what happens here in the state of Utah. Our legislative session, unlike on the congressional side where they meet all the time, is only 45 days. We have 45 days to get all the work done in the state of Utah. And that's different for every state. You have some states like, I think Nevada, they meet twice. They meet every other year for, I think, 8 or 9 months. But here in Utah, we only meet for 45 days. Those 45 days counts both Saturday and Sunday, and we don't meet on those days. So that narrows the work days down to even less time that they have to work through all the bills. We're on day 2 currently of the legislative session. We started just yesterday, so this is day 2. We're not quite done with day 2. On my last list I saw, there were 435 bills already on the list for this legislative session to be seen, heard, and talked through the whole process. On this list, as far as the legislators are concerned, we're very open here in Utah about our legislators and getting access to our legislators. Once you put in your address, you get that information. If you click on that person, it'll pull up in a lot of information about that particular legislator, in this case, Dan McKay. It'll give some background, contact information, a little bit about him. He happens to be an attorney in the real estate arena, is where he's at. I've known him very well. I've associated with him outside of legislature. He's got a son that's the same age as my son. They played baseball together. So I have a pretty good relationship with Senator McKay. And he doesn't live too far from me. He's not in my neighborhood, but doesn't live too far from me. Here we also have, like I said, the additional personal and career information, committees that he's assigned to, and then also the House districts that he covers as being a senator. In the legislature, there's only 29 senators, and then there's 75 House members. So a little bit different as far as those numbers are concerned. So he covers those different House districts there, and works with always works with those specific House members as well, because they both represent those people in those areas. Again, this is the committees that he's a part of. He may be just a committee member. He may be a committee chair for any of those things. But that's a little bit about him. You can also here see that there's a phone number, an address, and an email address listed there. Sometimes that address is the Capitol building. In this case, this is the actual Capitol building, the address. Some legislators will actually list like their home address, their work addresses. They'll list multiple phone numbers. For instance, if you look up Senator Vickers, he typically has his home address listed, his pharmacy address listed where he works at. And then he also lists his home number, his landline home number, his cell phone number, and his office number at the Capitol. And those are listed because legislators want you to be able to get a hold of them and talk with them. I was in a meeting with Senator Evan Vickers just today. We were talking with him in regards to some various things. We actually were there with some of the students from the University of Utah. They were at the Capitol talking with him about a few things. He talked a little bit about contacting your legislators and how easy it is to contact legislators here in the state of Utah. I'll tell you a couple things when it comes to contacting your legislators that I think are really important. From the APhA side of things, they talked a lot about having these letter campaigns where you can put your information in and it'll provide you with this letter that you can basically add your name to and send it off. And that works great on the congressional side of things in Washington, D.C., but on the state side of things, that doesn't work quite as well. He was just sharing, his intern was sharing that they had a specific bill. It wasn't even related to pharmacy, but it was just a bill that they had. It was, again, day 2, and they had somebody that had sent some emails out to their group of people for their organization. They had letters that had come in, and basically these form letters that come in. And he said that they had already, in this day and a half, excuse me, had already received about 3,000 emails, and they were all the same, every one of them. It was just like, here's the issue, this is what we want, and they were all the same. And he said, one of the things that's really important here in the state of Utah is make sure when you reach out to your legislator, let them know that that you are one of their constituents. You're one of the people that votes for them. That's one of the key things to remember. The second thing is make sure you address the issue and make sure you address it quickly and to the point, and don't have this long email that goes on about the issue. Get right to the point. He said those go a lot further than having this standardized form letter that are sent to our legislators. So keep that in mind when you reach out to them. And most of the time, those legislators will reach back out to you, especially if you're a constituent. Now, if you're outside of their constituent area, they may not reply to you right away, or it may be down the road or whatever else. They may not even reply at all. Don't take that as offensive. They seriously get thousands of emails a day in regards to the subjects that are going on at the Capitol. Last year, there were over 500 bills that were passed. That's just the ones that passed, not the ones that were killed, knocked down, didn't get anything done on them. That's just the ones that passed. And again, done in 45 days, that's a lot of work that goes on during that time. So when you reach out to a legislator, whether it's by phone, a text message, whether it's mail, email, whatever else, just be concise because they have a lot that's going on. The other thing that I would note too is often most of the work that happens at the Capitol, both on the state side and the federal side, comes from either their interns or their staff. Jeff and I have been in a number of meetings over the last year with some of our federal delegation. We've had them into pharmacies, and I'm sure Jeff will share a few stories in regards to that we've had over the last year. But those are important things as far as meeting with your legislator. Be concise, talk with them about the issues that are going on, get right to the point. But their interns or their staff people are the ones that really get a lot of the work done. When I'm at the Capitol, I do a lot of lobbying. Most of my contact, unless I've gotten through the first kind of gate, usually happens with the intern. There's an intern that kind of works through their schedule, sets up their meetings as far as Zoom meetings, things like that. And that's an important person to know and know who to get a hold of in regards to those things. If you're at the Capitol and you want to get a hold of them, start with this page right here. Oftentimes, a lot of these legislators, even though they have a phone here, sometimes that phone is manned by their intern. So they may not even answer it right away. So a text message may be a good way to do that. Introduce yourself real quick and say, hey, I want to talk about this particular bill or this particular topic. Do you have 15 minutes to talk about it? Don't say, hey, do you have an hour to talk about this? They're not going to give you an hour. Typically 15, 20, 30 minutes tops is what you're going to see because of all that they have going on. All right. I'm going to talk about a couple other things here on the legislative website that I think are very helpful for you. Obviously, under the legislative menu, that you can go back and see contact information, get to all the legislators. If you're getting somebody outside of who your own legislator is, I'll let you take some time to go through that at some point. The next one I wanted to look at was bills. Under bills, there's a few things I wanted to talk about. The first one is the 2025 bills. If you click on that particular list, it gives you a list of all the current bills that are available as of right now. This is current. And you could expand any of these to look at what the specific topics are. And you could go through and look at them and read all those bills. Can't sleep at night. There's a lot of bills that could put you to sleep. There's a lot of long ones. There's a lot of short ones that are really simple. But this could be a really difficult and a little bit overwhelming if this is how you have to look at all the bills that are all available out there. There's some other ways that we can actually look through these and get a little better idea of what's going on a little quicker. So come back up to here to this more 2025 general session information. This is probably one of the most valuable tools that you have when you're looking at legislation and advocacy here in the state of Utah. This particular page talks about everything that's going on during the legislative session and even after the legislative session. Talks about a number of things, but couple of the few things that I work and use pretty regularly is, first of all, under the bill tracking options, there's a bill request sponsor, subject, or committee. And you can click on this, and then you can go and find bills specific to subjects to legislators, or even to old sessions. So if I want to go back and find a bill from a previous session, I could even search previous sessions. So just for quick kicks, we're going to look through this list of subjects, and you can see there's a lot of lists of different subjects here. I'm going to come down here to pharmacy. And under pharmacy, there's actually a pharmaceuticals, a pharmacies, a pharmacist, and a pharmacy benefit managers topic. Now, when I started at Capitol, there weren't all these topics. There was a pharmacy topic, and that was it. It's changed over the years. We've expanded because there's been a lot more of the work that's been done. But if I quickly click on one of these, it's going to give us a little bit more information about what topics are there for that particular subject. This one was under pharmacist, but if I go to pharmacies, we're going to talk about one bill right here real quick while we're here. But this is a list of bills as of right now that deal with pharmacies. Now, you'll notice that when I switch between pharmacists and pharmacies, they changed a little bit because it may be specific to the pharmacist. For instance, there's a bill in regards to some of the licensing procedures for a pharmacist and how they're maybe changing. It has to deal with some background checks, things like that. But that won't affect necessarily the pharmacy. But let's come in here to one of these particular bills. And I think, Jeff, did you hand out my sheets? Perfect. So everybody has the sheet in front of you. I'm just going to note one of the bills here on this list, and we'll talk about it while we're right here. And this is HB 123. It's the Pharmacy Accessibility Amendments Bill. This is from Representative Daley Provo. I've worked with her over a number of years. She does a pretty good job representing her community. I think she's in the Salt Lake City area is where she represents. But she has a bill here. And this is the language of the bill. I'll help you through kind of understanding what the bill is just by looking at a couple things here. So the first area on here is the highlighted provisions. This is basically a quick overview about what the bill is about and what it does. In this case, the bill makes some technical and conforming changes. That's just a standard thing they always put in there, always making technical changes. It's a cleanup kind of thing of renumbering when it needs to be renumbered, things like that. And then requires a pharmacy to use an accessible prescription label for prescriptions dispensed to a patient who identifies as visually impaired or requests an accessible prescription. So as we look down through this list of information here, this is the current language in the law. This is coming from section 5817B 602. 5817B is the Pharmacy Practice Act. So that's a section that I watch pretty closely. But if we follow down here, in regards to this happens to deal with labels. This section here in red that's underlined is new language that they're looking to add. Whenever you look at a bill, anything that has a new underline in it is new language that's going to be added to the legislation or to the law. If it has a line through it, that means it's a strikeout, and that means it's going to be eliminated. So they could be adding or eliminating language. In this case, they're going to be adding stuff. And this says that a pharmacy shall provide to a patient an accessible prescription label in accordance with subsection 6B and C, affixed to the patient's prescription container if the patient informs the pharmacy that the patient, one, identifies as a person who is blind, visually impaired, or otherwise unable to read a standard prescription label, and requests an accessible prescription label. Then B says the pharmacy shall, that's not a may, but a shall, that means they have to do it, shall provide an accessible prescription label under subsection 6A. And that was the section above. And it says in a timely manner, comparable to other patient wait times, that lasts for the duration of the prescription and subject to subsection 6A in a format that is appropriate for a disabled preference, disability and preference of the person making the request through the use of an audible, large print, or braille label, and contains the minimum information required under subsection 5. So the basis of this bill is they want to require pharmacies to provide a label when somebody requests it that's either in a large print, an audible, or a braille version. Sounds pretty reasonable. When you start talking about it, we want to make sure that we're providing those things to those patients that may need that. The reality of it is this could be something that could be costly to the pharmacy as well too. So it's a delicate balancing act on a bill like this to make sure that we're also advocating for the patient, but also advocating for the costs and the operation overhead of the pharmacy. Jeff and I did some quick looking to see what pharmacies offer a braille label already in the state of Utah. We couldn't find one. So if every pharmacy has to be able to provide that option, that could be pretty costly to the pharmacies in Utah. So we start thinking and brainstorming about ways that we could potentially fix an issue like this. So it's a bill that makes sense to be able to provide the right information to the patient, but we want to make sure that it's not going to be costly to the pharmacy. So a couple thoughts we had is it could be that a pharmacy, instead of requiring to have it, may be able to provide a reference to a pharmacy that does provide it, that service. Then a specific pharmacy that wants to get into that niche market of being able to provide the large print labels or audio labels, or the Braille could be able to provide that. We already do that with a number of things in pharmacy, from compounding. Not every pharmacy does compounding. Some do, some don't. We do things like medication packaging and adherence. Jeff does a lot of that in his pharmacy. It's very unique for what he does, but not every pharmacy does that. So being able to provide an option for a patient to go to another pharmacy, or the other option we considered is maybe we have the state or the division, in this case, maybe DOPL or the health department or somebody like that, keep a list of which pharmacies are able to provide that service that those patients can go to, and then go to those specific pharmacies. That way the accessibility is still there, but it just does not become a burden on every pharmacy. So this is somewhat of the process that we have to go through each year with each of these bills that come up in regards to pharmacy, to make sure that it's beneficial, not only for the patient, but for the pharmacy, the pharmacist as well too. So questions there? Tell me your thoughts on a bill like this. Anybody? Like it, don't like it? Yeah, go ahead. Uh-huh.
How are we going to implement that? How is it going to cost? Are we going to contract with a separate business to produce this for us?
Correct.
All that kind of stuff. So, but yeah, I think that's a really good idea that I was thinking about, maybe designating a specific pharmacy, referring to that, or things like that. So it's one of those things where it's really interesting. You have to be
Right.
very, like, well, how great idea.
Right.
Yeah.
Right. Any other thoughts, Jeff?
So I agree with what you're saying, and I think anybody who looks at this thinks, wow, we want to make sure our disabled patients are going to have access to understand what their prescription is and how they should take it. I don't think anybody wants to fight against that. And I think if you went out there and tried to fight against that, it'd be a very unpopular stance, right? The problem is
For our online people. Sorry.
there's also language in there that says we have to do it at the same wait period that we provide any additional prescription to another patient. That makes it hard because we can't use a third party. We can't use an off-site company to help us with this. It has to be done in the same wait time as what they're asking us to do it in a similar wait time to what we'd provide a typical standard prescription label in. And so, I mean, I think looking at this law as it stands currently would be very difficult and challenging and very expensive for pharmacies across the state to be able to implement the way that it's written. So, you know, when we look at this, we talk about, okay, so what, you know, if we want to provide this service, we want to make sure that patients are taken care of. How do we address this in a way that can do that at the same time protect the pharmacies that are behind it? And that's where Adam and I talked about, you know, if you wanted to add all this code, all this language to our Pharmacy Practice Act, that's fine. The hard part is our Pharmacy Practice Act is getting gigantic. You guys know, you're studying it for your law tests, right? I mean, there's a lot of pages that we have to study. So adding additional language is tough, but you know, sure, if you want to add this in, that's fine. But I think we should try to fight to say at the end, a pharmacy must comply with the above language, or must provide the patient with the name and number of a pharmacy that can provide these services. If we're allowing our patients to have access to that, whether we provide it directly to them or we help refer them to someone that can, to me, I think that would satisfy what the law is meant to be.
One of the things Dr. Wetzel talked about in the previous presentation was talking about the reimbursement side of things and the money that comes in. And that's already being cut down. It's already minimal. So now if we're adding additional costs, that reduces it down even more. Senator Vickers today was talking about an experience he had where he was talking with one of his vendors that does all that pricing for him. And he asked the vendor, well, if you had something that you were having to buy for $11 and you were getting paid less than $1 for it, would you continue with that contract? He's like, well, no, I wouldn't do that. He's like, well, then good, I'm canceling my contract with you right now. Because he's like, because that's what's happening with the contract that I have with you as a provider of these medications and what's getting reimbursed back to him. And so he was able to start looking at those kind of things. But it takes that kind of effort to look at things like this, look at PBM legislation to actually make a change. That's where organizations like the Pharmacy Association, USHP, APhA all come into play. And there's a lot of organizations that help with those different things, whether it comes from the compounding side, the chain drugstore side, whatever it is. All those organizations have one goal in common, is that's to help the patient, to help the pharmacy, to help the pharmacist, the pharmacy technician as well. They're all essential to that whole process. So any other thoughts on this bill? Yeah. I don't know where the microphone ended up, but let me grab it here. Thank you.
I have a thought and a question. I mean, one thing too, operationally, there's a lot of requirements on what needs to be on the prescription label already. And so some of these like large print, you know, I don't even know how we would do that, right? So making sure all the options that are even in the bill are reasonable. My question is, and this may be not relevant, but I'm always curious why a senator chooses to introduce a bill like this.
Sure.
You know, were there a lot of constituents that are having this issue, or was it something other pharmacy associations have advocated for? Or, you know, do we know anything about the background?
Yeah, that's a great question. And it comes up quite often. I'll tell you that most of the things that happen at the Capitol happen because a constituent goes to their legislator and says, hey, this is an issue I've been having, and I'd like to have it fixed. I would say that's probably 95% of the time of what happens is based on that kind of discussion. I can give you numerous examples of that. As mentioned in my introduction, I own an association management company, and we manage a number of different associations, pharmacy being one of them, but we deal with other industries as well too. I had another bill that just came up in the RV industry. We manage the RV Association as well. And it has to do with creating a lemon law specifically for RVs, because one constituent came to their legislator and said, hey, I had this really bad experience with some warranty issue on an RV, so I think we need a lemon law. She's like, okay. Just one person. So that's the normal process that happens. Now, that's not always the case, because you have organizations like UPhA, USHP, the Medical Association. There's a lot of associations out there. They look at things that are going on with their industry and say, hey, we need to make a change. And so they'll come up to a legislator and say, hey, we have an industry issue that's going on. We need to take care of that. A good example is on that list, there's a bill at the very top that's highlighted in yellow. That's the Pharmacy Practice Amendments bill. There's no number with it. It just says BB. That's a boxcar bill. That is from Senator Vickers. Every year, Senator Vickers has a bill that he opens, a bill file opens to help with updates to Pharmacy Practice Act or things that just need to change within the industry and profession. So that bill is there, and about probably halfway through the session, from working with Pharmacy Association, USHP, the State Board of Pharmacy, and all the things that are going on, he'll put that language out there finally, and we'll run through that towards the end of the session to get those things changed. So that's more of an offensive side of things that happens. A lot of associations and industry play a lot of defense because of legislators that have one constituent that comes to them and says, hey, we need a law change. And because those people don't necessarily understand the industry or the profession, they're like, okay, let's do it. And that's what happens. And so then there's this extra battle that happens. It would be ideal as if those legislators that are approached went to those industries and said, hey, here's the approach that came from a constituent. What can we do to fix this? And if they did more of that, we would have probably half the number of bills that we have at the Capitol. So sometimes I wish that for every bill that was passed, they had to repeal two. It would be make things a lot more simple, but that's just not the way that it works. So that's a little bit about that process. Any questions there? Any other thoughts from anybody? Okay. We jump into a couple other things here real quick. I'll share one other section here. It's not going to show a lot here, but under bills under tracking service, this is one of the great tools that is available on our legislative website. You may have certain things that that you're interested in, hobbies or things like that. But on here, there's a tracking service you can sign up for. And then when you go into a specific bill, once you create your account, log into it here. I don't have my login information, but I could show you my list. There's about 85 bills on it right now already. But if you happen to go into a bill, you can use this button right here called Track This. It will add it to your list. And then Whenever there's a change in that bill, it'll email you, and it'll also provide updates on that tracking list so you can monitor anything that's going on. You may have certain hobbies that you like. For instance, I like to keep bees. I have a couple beehives at my house. So whenever there's something related to bees, I get updates on those particular subjects, okay? I also like the outdoors and things like that. So when there's certain things related outdoors, I'll monitor those type of things. I also have a home in an association, a homeowners association. So changes to homeowner association policies, I follow those type of things. I can track all of that from here. Give me updates when those things are on committee. So not only do I use it for the personal, but I use it for the business side. So I know that a bill is coming up in committee. So if I'm looking at a particular bill like this one right here, this one's going to be in committee tomorrow. Tomorrow afternoon, this bill is going to be in committee. So we're working with the legislator to come up with solutions. Myself and a few others will be at the Capitol, and we'll address our concerns with the committee. We've had additional conversations already with the chair of the committee that's going to be in. This one is going to be in the Health and Human Services Committee, I believe is where it's at. I don't have my list in front of me, but we've had conversations with that chair already. In fact, that committee chair is a representative of one of our pharmacists, so he already reached out to the pharmacist or reached out to him and said, hey, this is an issue that's coming out. These are our concerns. We're not against helping these people out, but these are the concerns we have. We want to come to a conclusion with it and some type of solution. So he understands where we're at. Those committee chairs carry a lot of weight because oftentimes if somebody doesn't know how to vote, they may follow along with who that committee chair is. So even just having those relationships. So this is out in Tooele, Sheldon Birch with Birch Family Pharmacy. He spent a lot of time with his legislator. He's gotten to know him. He's a fairly new legislator. I think he's only been there for a year or two is all. And so he's gotten to know him, and he has those continual conversations with him out in those areas. And those are the kind of conversations that make things happen in the world of politics. It's not about just sending your email to your legislator. You have to have those ongoing conversations and talk with them on a regular basis. Senator Vickers today said, in talking with a group of other students, said it'd be ideal if you could go to lunch with them and get to know them that way. But the reality is that just doesn't happen. But if you can have those communications, emails, knowing who they are, they may already be coming into your pharmacy. You just don't know who they are yet. So knowing who they are so that when they do come in or you approach them, wherever it is. You know, I run into legislators all the time at various places, from the grocery store to traveling out of town to University of Utah football games to basketball games, wherever it is. You know, I run into them at different places, and being able to recognize and know who they are and them knowing who you are is a key piece to being successful in the advocacy effort side of things. So any other questions so far? All right, I'm gonna jump over here. Let's see, let's go back. Make sure I got everything over here. During the legislative session, because things move quickly, one of the other great bill tracking options is the list of new bills. And this usually shows the last week's worth of new bills that have been numbered. So these are all the bills that have been numbered just today for January 22nd. And you can see any of those topics. You can click into them and then see more information. The nice thing about, excuse me, about legislation in the state of Utah versus in Congress is that if a topic of a bill, like for instance, local land use regulations restrictions, SB 152, so that we know that that bill based on that title deals with local land restrictions, local land use regulations and restrictions. There will not be anything in that bill related to medical or pharmacy or anything like that based on how Utah law is. Now on the federal congressional side of things, there could be anything in that bill. If you listen to the news or follow anything political, you could have a bill that's like 1,000 or 2,000 pages long, and it could have farm use stuff in it, and it could have medical stuff in it both. And it makes it really difficult. But here in the state of Utah, it's really easy to follow and make sure you know what you're looking at because the title has to match what the subject is. So these are the bills, again, from just today. There's also, up here at the top, is recently requested. And if I click on this recently requested, these are bills that don't have a specific bill number yet, but are just requested bill files. They become those on that list, that BB list. Those are called boxcar bills. There's a file for them, but no language that's been made public yet. So we'll come in and watch all of these type of things. So these are nothing from today. But we'll see a few more coming as the weeks go by. And we can go back to the recently numbered as well too. So again, that was today. This was yesterday. One on the list is the glucagon amendments. That one's on the list of what you have in front of you. And then the last area I want to just share with you too, and you could spend more time, we could spend an hour just walking through this website and the tools that are available to you, is just the code section. Under Code and Constitution, if you click this, you can search the code by title, chapter, and section. And this is where you become familiar with certain areas. In this case, Title 58, Section 17B is the Pharmacy Practice Act. You can come in here and dive into each of the different sections, or you can download the whole section in a PDF, or different options that are available to you. So become familiar with it. I think this is a very intuitive website compared with a lot of the other states, and it reads pretty well and pretty easy. So if you've gone into any other state, you might find it a little more difficult, but Utah does a great job of it. Let me just end by talking about, how much time we got left? Okay. By just talking through this list of bills that we have so far. Again, this is day 2. This is a front and back. The bills that are highlighted in the yellow are kind of our priority bills that we're watching to start with. Doesn't mean the other ones are less important, but those are the ones that are probably going to have the bigger impact right at the moment. As I mentioned, the HB 123 is the Pharmacy Accessibility Amendments Bill. That's the one we already talked about. So again, in yellow there. A couple other ones I wanted to just note. So we mentioned the Pharmacy Practice Act. We'll see language coming out on that probably in about 2 to 3 weeks from Senator Vickers, probably just following Pharmacy Day. HB 52, Health Insurance Modifications. This is a bill that we've been kind of following. We've been a little bit active on it, but not like super active. It's not like a high priority. This is what's called our copay accumulator bill. Basically, the bill requires the health benefit plan to count all payments that are paid. If it comes from a card, it comes from wherever, it would count towards the payment. And the way that the law is currently set up, it doesn't allow for all of those things to count towards the payment for that patient. So this is a bill to hopefully take care of that. So we're watching that closely. We're part of a patient advocacy group that we've been part of that follows along with that bill. This is probably the 7th year that this bill has been on the list. And for various reasons, it didn't pass. There's a lot of different entities that are part of the discussion of that, from the insurance companies to the PBMs, patient advocacy groups, pharmacy. We obviously have a little bit of interest there as well too, mainly because we have to deal with the patient, what's coming in, and they're talking with us about the payment side. So we oftentimes have to provide the bad news, which is unfortunate. So that's one that we're watching closely. And then HB 257, Pharmacy Benefit Amendments. This is a bill that Representative Thurston is running that deals with PHP. That's the state employee health program. Some changes going there, and hopefully some changes in regards to the PBM side of things. We've been really good about making some changes on PBM legislation here in the state of Utah. We still have ways to go, but I would say that we've done a lot more than some other states out there, which is a little bit reassuring. But Jeff, do we still have a long ways to go? We do have a long ways to go. There's still opportunities that we're working through. We're having conversations with Medicaid. Those are things that don't show up on this list, are things like Medicaid. Jeff and I have spent the last year with Senator Vickers working through things in regards to Medicaid, on how Medicaid is getting reimbursing pharmacies, and we're getting close to the finish line on a solution for that. But again, that's not something that shows up here. That just happens through administrative rule changes within the Division of Medicaid and Department of Health and Human Services. So those are the things that we're working towards. Anything on that list stand out to you that is of interest to you, besides the ones we've already talked about, or questions on? I want to take the last 2 minutes and just talk about pharmacy down Capitol Hill and what to expect up there as well too. That works. Anybody been up to Pharmacy Day on the Hill? Okay, we've had a couple here. Okay. But last year we didn't get an opportunity to go up there as far as like with a big group like we are looking at this year with the different organizations, the other school. It's really difficult to actually get time at the Capitol. You think, oh, it should be easy to get some time at the Capitol in the Rotunda. It's a pretty popular place, and you don't always get what you want when it comes to that side of things. So there's a process in place that you have to go through in order to get just a date selection. I actually just went through the date selection for 2026. I just secured those dates, just so you're aware. February 11th for that, so I have those all secured. So make note of that. But there's a process and emails have to be sent, and then you have to go up to the Capitol early in the morning, and it's quite the ordeal to get it, but we were able to secure those dates. So we have time on February 12th this year from 11 a.m. to 2 p.m. We used to, when we first started doing these, we'd be up there pretty much all day. We'd be up there like 8 o'clock in the morning and go till like 3 to 4 o'clock in the afternoon. Because of the popularity of the rotunda, they only allow you a 3-hour block now. So we'll make the most of it. Our preference is to have that 11 a.m. to 2 p.m. time, because that gives us the chance not only to share our posters, to have some health screenings provided to the public, but more importantly, to have lunch with legislators. There's typically 2 days during the week that allow for an organization to do that, either Mondays or Wednesdays. So we'll be up there on a Wednesday. And last time we did this, we saw probably about 65 to 70% of the legislators come down and have lunch with us. So as was mentioned, we'll have the posters up there. How many in the room are working on posters? Okay, most of you here, perfect. There'll be opportunities for legislators to come down and they'll visit with you. There may be other pharmacists there that will talk with you, or just the general public that'll come into the rotunda and talk with you about your poster. That's why we try to encourage you to keep those topics simple as well, because sometimes it's the general public and they don't know all the details about pharmacy. 10 years ago, I didn't know all the details about pharmacy. I've learned a lot over the last 10 years about subjects I never imagined I would even know about. But then we'll do the health screenings, and he obviously went through some of that training already today, and we'll go through and do a number of those health screenings. We'll have a lot of legislators that will come down. That's a captured audience right there, where you can, when you're pricking their finger, you can talk about legislation that's going on. And that may be stuff that's pharmacy related, or it may be just things that they're working on. Ask them about the topics of laws that they're already working on and what they're about. And they love to tell you about those things. And that'll give you a chance then to share, hey, these are some of the issues that are going on with pharmacy. And then last, the most important one is having lunch. So we'll have some catered lunch there. We'll have the tables all set so you can sit down with legislators. A legislator may say, hey, I'd love to talk with you during lunchtime more about your subject. Dr. Garcia that was in here doing the training, she's done that numerous times where she sat down with legislators and had pretty lengthy discussions about what's going on in the profession. And it's a great way to inform them about what's going on, because other than that, they may not have an opportunity to do that. So a couple things to be aware of when you go to the Capitol: make sure you wear good shoes. It's a hard marble floor, so wear some comfortable shoes. There's parking. It's somewhat limited. Park on the east side of the Capitol. There's parking on the street. There's parking up the hill. There is 2 kind of public parking areas. But I will warn you right now, there's construction going on a new building. They're building on the north side of the Capitol building. So there's a lot of construction workers as well, too, that are taking up a lot of spots. So give yourself plenty of time when you get there. When you go in the Capitol, go in from the east side of the Capitol. There's a main door you go in. When you go in that door, you'll go up the stairs into the rotunda. If you are bringing any bags, there is a bag check that you have to go through there that's run by the Highway Patrol. If you don't need to bring a bag, don't bring a bag. It'll allow you just to walk through. You don't have to wait in line, you just walk through, okay? Again, make sure you wear good shoes. Also make sure you wear your white coats. We're working through the schedule on how it'll all work to get you up to the House Gallery and the Senate Gallery. We typically have one of our senators and one of our representatives do a quick introduction on the House and Senate floor, where they will have you stand in the House and Senate Gallery. They'll introduce you, and they'll say what's going on in the Capitol Rotunda and invite all the legislators to come down for lunch during that time frame. From basically 12 to 2 is what they have for that time frame. Again, it's a great opportunity to be in front of them. Again, shoes is probably one of the most important ones. Don't wear the high heels. Wear something that's comfortable to be in. And what else am I missing in regards to Pharmacy Day?
Say, since we are starting later than normal.
Sure.
Parking was crazy when we got there at 8, so I imagine 11 is going to be even more insane. So
You may have to walk a little bit when it comes to parking.
Yeah, be prepared to walk and carpool. Check for street parking, because there are a lot of signs and designations where you're not allowed to park without a parking pass for those specific.
Or it'll be
days.
1 hour parking or things like
Yeah,
that.
or 1 hour parking.
If you
And
park
then-
on the east side, all of that's pretty much available. And then the 2 parking lots that are on the east side of the Capitol and Senate building. And there's also a road that kind of goes up the hill, kind of behind the Capitol. There's designated parking along the street there, but just know you may have to hike a little ways to get down and up to your car.
And one final warning is to make sure that your registration sticker is not expired on your license plate. I have gotten a ticket every single year because I needed to get it done in January, and it's never on my car in February. So I get ticket every year for not having my registration sticker up to date. So check your number on your license plate, and if it is not correct, carpool with someone else.
Any other questions anybody has? Jeff will talk a little bit about the Pharmacy Association a little bit later too, and some of the things that we've been working on, but that's just a quick overview. We could spend another half an hour talking about various things that have happened over the years, but any other questions anybody has? Thank you for letting me be here. Yeah, go ahead. Sure.
Earlier to the Capitol building to kind of try to catch interns or to
Sure.
try to talk to anybody that's kind of walking into the building. So I guess there's still that option also if you did want to come earlier and
For
hopefully
sure.
there'd be more parking earlier or staying a little bit later after the posters to also catch interns or anybody there talking. So there's that option as well.
Perfect. Yeah, there's the Capitol's open anytime. You can go up anytime of the day, even before the session or after the session. It's pretty much open. There's no like metal detectors you have to walk through. It's pretty much open. Highway Patrol monitors everything that goes on up there. They do a great job, so you'll see a lot of Highway Patrol officers up there. But you're always welcome to go and wander through it. If you're not allowed into an area, the door's locked. You won't let you in. So if the door's open, you can pretty much go in there, or there's somebody there that will direct you on whether you can go in or not. Like things like the Senate and the House Gallery, they'll direct you about where you need to go when you go in there, or that you need to be quiet, or various things that are going on with it. So yeah, great comment. But yeah, you can go up anytime. You can stay afterwards for committee meetings. That 12 o'clock to 2 o'clock time is the legislators' lunch break. And that's why it's crucial for us to kind of be up there during that time, because it gives us an opportunity to be in front of them. We don't always know whether committee meetings are going on or floor time or what's going on. Most likely it'll be floor time from 11 to 12 o'clock during that time. And then at 12 to 2 is when they'll be off the floor for their lunch break. Any other comments or questions? All right, I'll be up there during that day. So if you have questions, feel free to come and talk with me. I'm happy to share information with you. If you need to reach out to me, I'd be glad to give you my cell phone number as well, or email, whatever. I'm happy to share whatever I can. So,
Thank you so much.
all right, thank you.
Okay. So now we're going to have a brief break for you guys to grab some food, because I know it's an evening and class all day or at work all day. So we have pizza in breakout room 121. So we'll have 15 minutes for you guys to get some food and get settled and take a little bit break. But I believe Dr. Oswald is on the line, and she, while you are perusing the pizza, has some updates about Nevada's Board of Pharmacy that just had a meeting recently and making some big changes. So I think she just has a couple of things she might want to share with you guys, so we can brainstorm, do we want this in Utah?
All right, can you hear me okay in there?
Yes.
All right, I see that. I saw, oh, that was Caitlin's thumb went up. Yep. So it definitely, it is not rude to me right now. If you guys stand up and you walk and get pizza and you can still hear me, that is okay. So I know you've been sitting for a little bit, so please feel free to stand up and get pizza, and I'll share a little bit. And Dr. Kunke is on here as well. I'm going to invite Dr. Kunke to talk a little bit about some of the legislative proposals that he's got on the table with Nevada Pharmacy Alliance. So for those of you who are familiar with graduating, you have to take a law exam. Anybody know what it is? Quiet in there. So even if you were saying it, it'd be the MPJE. And we have historically low pass rates in Nevada, almost down to 50%, 60, 50, 60, 70% year over year for a passing rate on the MPJE. And this was a discussion point in your curriculum committee here at Roseman. It's been a discussion point for Nevada Pharmacy Alliance. Nevada NVSHP also had it as a discussion point. And can we get better materials? We've met with the board that write the questions and kind of just like guidance for how we can help to prepare test takers, not cheat in any capacity. And, you know, this year, even in the curriculum committee, there was some real passion about, you know, can we get rid of the MPJE? And that is a statute in Nevada. So no, we can't just get rid of it because we want to. That would have to be legislators that would approve that. But, you know, Dr. Kunke, Dr. DeSerbo, and some other faculty, they identified there's nothing that says you have to take the MPJE as a law exam. And so we kind of met as a group. NVSHP had met, and Dr. Kunke was really proactive and put together a little document of like, what would be some of the things we could say to the board to get them to drop MPJE and do a board administered exam. And that ended up, I'm going to replace the current share. I don't know if this will share or not, with a proposal that we had pretty much ready to go if needed. We had the ideas, and an opportunity presented itself. You've heard about networking and the importance of networking and knowing people. And through some of those networks and connections, the board reached out if we would be interested in changing some policy to allow students to take the MPJE at the end of the P2 year for us. And so you'd have all of your APhA year to take the MPJE, which if you're not going to pass it first time, gives you some built-in wiggle room. And then you focus on NAPLEX when you're done. And we said, yeah, that would be interesting, but how would you guys feel about dropping MPJE altogether? And they said, kind of bring us a proposal, bring it to the board and see what they would think if there's an appetite for that. Turns out Nevada has a software system already in place. They do this for nurse practitioners and to a degree for physician assistants as well. And so just this past week, myself, Dr. Kunke, Dr. DeSerbo, Dr. Fannin, or Dean Fannin, we were at the board meeting with other faculty online, residency directors who had heard about this. And we successfully saw the board of pharmacy approve a Nevada administered law exam instead of giving the MPJE, which is something that will allow graduates to take it faster if they don't pass necessarily. It might be a little bit more educational. They might know what they missed. So that's just one win for Nevada that kind of came together from Roseman, and maybe something that Utah would be interested in doing as well. And I'm going to turn it over to Dr. Kunke.
All right. So first of all, I see a lot of familiar faces in the classroom. Thank you so much for joining tonight because this is such an important topic. And I'm sure that all of you are going to also participate in the posters and the Pharmacy Day in the Capitol. So I just wanted to go over some bills that we're going to be running here in Nevada that you guys may be interested in. The first one has to do with pharmacists' scope of practice. So right now in Nevada, there's certain things that pharmacists can do, but we want to try to open that up a lot. So the first BDR that we're running is BDR 344. And what this would allow is pharmacists to prescribe for conditions that do not require a new diagnosis. So if a patient was diagnosed with diabetes, a pharmacist could actually assess that patient and then change their therapy, change the type of medication, the dose of the medication, whatever's needed, as long as they were diagnosed with that before. The second thing are minor and generally self-limiting conditions. So think of lice or something that goes away by themselves and it's not going to be a chronic condition. So if they present that way, we could also assess and prescribe for that. As many of you know that throughout the pandemic, pharmacists have been using CLIA-Wave tests to diagnose for COVID. And based on what that test said, they have been able to prescribe medications for COVID. We are asking for all CLIA-Wave tests to be able to be used. And if that has a positive result, we would be able to prescribe for that. And then our patient emergencies. So maybe a patient comes to the counter and they're an asthmatic, but they don't have any proof that they're an asthmatic, but you can hear them wheezing. You would be able to do the documentation and provide prescriptions for patient emergencies. Another thing here in our state is that we can order lab work in some situations, but we cannot in other situations. So this bill would allow pharmacists to order lab work and serve as directors of exempt laboratories in all situations. And then once again, we could administer medications in some situations, but not in others. This would open it up to allow us to actually do all administration. So that is a big scope bill that we're going for. The other four bills all have to do with payment for services. So some of that is payment for services for dispensing. So you guys were talking about pharmacy benefit managers. We have two bills that actually would have deal with pharmacy benefit managers and making sure pharmacies get the correct payments, and also patients, they have access to care. And then the third payment bill that has to do with dispensing is for 340B pharmacies. And right now there's a federal program that reimburses pharmacies at better rates to take care of uninsured or underinsured. Well, there are pharmaceutical corporations that aren't doing what they're supposed to be doing with that actual program. So this bill would prevent them from not providing the drugs at that cost. And then finally, we have a bill that we talked about pharmacists doing clinical services. Well, right now in Nevada Medicaid, we can only bill for certain clinical services. So this fifth bill would require billing for all clinical services provided by a pharmacist through Medicaid. So lots of good things trying to get pushed through. And if you have questions on any of them, just reach out to me and I'll be happy to share the language or answer any of those questions.
You have a question in the class, so let me just pass off the microphone real quick.
Ken, this is Adam Jones from the Utah Pharmacy Association. Just a quick question.
Yeah.
Just because of how we deal with some things here in Utah, one of the big things that we kind of have to overcome is the 800-pound gorilla in the room when it comes to these topics, and that's our medical association here locally. What's kind of the relationship with, in regards to the medical association there in Nevada? And because oftentimes when we're looking at legislation that expands scope of practice, it's like Senator Vickers, who's our lone pharmacist, says it's like poking the bear, and the bear's going to bite back, and it's going to bite back hard. And so just wondered how that process works and that relationship there and how they see some of these things happen.
Yeah, that's a good question. The good news is that we do work with the medical association on some of these bills, such as the PBM bills. They have been a part of our coalition, and they know that it's hurting patients, so they are helping with that. They do not like some of the bills we're running, including the advanced scope. So what is happening is we had to tailor the presentation to prove that these services are going on in other states and that they are safe. Pharmacists are trained to do these services, and there hasn't been complaints in the states that are doing them or problems in those states. And also that we have a problem with access to care in our state. We're ranked 48th out of 50. So, we keep talking to the actual elected officials about that. We are trying to meet with the medical association to find out what exactly in these bills they don't like, to see if we can come to a consensus before session. But we have not been able to have those meetings with them yet. But we are trying to work, and at the minimum, when the elected officials ask us if we try to work together, we can say yes, and then we can explain what we tried to do. But we know that we're going to have opposition, and we just need to be prepared for that.
Perfect, thanks.
Hi, Adam, by the way.
Good to see you.
Okay, we got one more question.
Okay, hi, I'm Katie. I'm a student at University of Utah. I am curious if Nevada is moving towards a direction like New Mexico College of Pharmacy, where they have that like pharmacy clinician certification, where they're able to prescribe certain medications for certain like diseases. And I'm curious if this would have anything to do with like the direction Nevada is moving, or like if that is something that they're also looking into doing. I don't know if you've heard of that.
Oh,
or-
absolutely. Yeah. So California, New Mexico, and Florida, they have the pharmacy clinician titles. As these protocols have been going into place, what they realize is it's creating a lot of red tape for pharmacists to have to jump through to actually be able to do these services. So there's been low uptake in the clinician status. So what most states are doing is they're trying to bypass that status and go right into a bill like we are presenting here, which would actually really open it up for everybody. But the actual companies would have to prove that the pharmacists that work for them do have the training, they do have the education to provide these things, but it's not put in law saying exactly what needs to be done at what time and things like that, because as guidelines change, those laws get antiquated. So right now, Colorado and Montana have the exact language that we're going for. And then Idaho and Iowa have complete open scope. So they can actually do anything that they, including diagnosing, where we're not looking for diagnosing right here. But Idaho and Iowa have opened it up completely. And it's been a step-by-step process in both of those states, but we're hoping to see more and more states keep going to that open scope of practice.
Awesome. Thank you so much.
I'm going to take one more question so we don't run too far into our next sessions. We got one final question. Thank you so much for sticking on and providing us with this hot update.
Hi, how's it going? This is Anthony, B1. How are you doing, Dr. Kunking, Dr. Oswald? So I wanted to ask, it was brought to my attention that I know in Nevada, there was a, there was something that was talked about within the last couple of weeks in terms of pharmacist to prescription ratio. And I know that was implemented in like 2022. As of right now, there was I was told like it was very recent that there was some sort of kickback. I know that was a topic to help go against medication prescription errors and also to combat pharmacist burnout. Have we heard anything about that, and what was the status of that?
Yeah, Anthony, good job being on top of what's happening in Nevada. So that is definitely a regulation of interest across many sectors in pharmacy right now, both in Nevada and nationally. And what you are referring to is basically the Board of Pharmacy did a survey of all pharmacists, an anonymous survey, and published the findings. And of the 600 or so responses, a high proportion of those 600 or 800, Dr. Kunke, you can correct me here. I've got it sitting right here. The whole survey. It was quite thick that they published out. For the respondents in the retail community setting, it was identified that a high percentage of the responders, hundreds, felt that it was unsafe in the staffing conditions that they had. And that they felt that they may create errors, unnecessary errors. It was kind of a high level summary of the findings of that very thick survey that they published. And so in the board's response of public safety, they proposed some regulations that would require a staffing model where if a pharmacy is filling 20 or more prescriptions per hour on average, that pharmacy would need to be staffed with both a dispensing pharmacist and a clinical pharmacist. And then to do additional clinical services, another pharmacist would be required to be there. It does increase the technician to pharmacist ratio. So we have a current ratio of 3-to-1 at the community pharmacy setting in Nevada. There is no ratio in Utah for technicians to pharmacists, for example. And so this kind of increased that ratio a little bit, but also mandated some additional pharmacist help per hour. And that the regulations right now are not, they're on hold. They're still being discussed. So at the meeting last week, also where Dr. Kunke was and myself, many representatives from the retail sector, as well as Dr. Kunke went up and spoke for Nevada Pharmacy Alliance, shared their thoughts. There are concerns about economics behind such a strong mandate for multiple pharmacists to be working at the same time. And so the board listened to all of the open comments, but it was not voted upon. It is continuing discussion. And Dr. Kunke, if you want to add anything.
No, that's a great recap. It is a proposed regulation. It's never gone into place. It was voted on, but it had to go to Legislative Council Bureau to make sure that it fit in with the law. Legislative Council Bureau did okay it. It came back and it never had a final vote. So right now they're just taking public comment and the final vote has not come up. you know, it's always important to make sure that when a regulation gets passed, it's doing what we want it to and not hurting other things. So right now we are the Nevada Pharmacy Alliance, which represents the actual teams, the pharmacists, the technicians, and the interns. We are having conversations with the Retail Association, who represents the actual companies. And they're like today we discovered 10 questions that we wanted to ask the board, and we're continuing to build those questions, and we're hoping to get those answers to make sure that if this does get passed, it gets passed, you know, with the right intentions and doesn't hurt the actual business structure.
I want to give a real shout out to Dr. Kunke leading up to last week's meeting and continuing forward. I don't know that there's a day that he almost doesn't have a meeting with someone advocating, but also in his role of leading that state organization. That again, they're doing right by the pharmacists and the public health as these regulations and or statutes are being brought forward. But it's a lot of work. It's not a one-time thing. When you're passionate about this, and I'm sure some of the other people in the audience are nodding their heads right now, it is a constant, consistent stream of communication that he really does, and we're very lucky to have him in Nevada and at Roseman.
Thank you so much, you guys. We're going to continue on with our next session. I think everyone's got their pizza and they had a chance to go to the bathroom. So I'd love to welcome up our next speakers. We have Dr. Carrie Dunford and Dr. Pinnock, and I have their slide decks ready. So I'm going to go ahead and set up the computer for them really quickly. Just got to do some shifting. Oopsies. Okay. Do you have a microphone preference, lavalier or handheld? Okay. Okay, who's going first? Me. Okay. All right, so I'm going to just do a quick introduction just so you know who's talking in front of you. So Dr. Dunford is the Chief Pharmacy Officer and Vice President of Clinical Services at Intermountain Health. She is responsible for leading enterprise pharmacy services for acute, ambulatory, community, home delivery, and specialty pharmacy, as well as pain services. Dr. Dunford earned her Bachelor of Science degree in pharmacy from the University of Utah, a Doctor of Pharmacy degree from Idaho State University, and a Master of Business Administration degree from Western Governors University. Dr. Dunford has more than 20 years of pharmacy experience with expertise in clinical pharmacy, pharmacy operations, and regulatory compliance. She is currently a pharmacist on the Utah State Board of Pharmacy and USHP Advocacy Committee. Dr. Dunford lives with her husband and two sons in South Jordan, Utah. In her free time, Dr. Dunford enjoys the mountains of Utah, specifically Bear Lake and Fairview, boating and snowmobiling. Dr. Pinnock is a clinical pharmacist at Intermountain Home Care Pharmacy, focusing on home infusion services, including IV antibiotics and total parenteral nutrition. She earned both her Bachelor of Science degree in health policy and Doctor of Pharmacy degree from the University of Utah. While in school, she enjoyed leading various student organizations and working as a teaching assistant for multiple courses. A highlight was interning with Senator Evan Vickers, who we will hear later, a pharmacist and a majority House leader during the 2022 legislative session. She served as the USHP board liaison to the Advocacy Committee from 2022 to 2024 and enjoys being involved with pharmacy advocacy in Utah. She enjoys spending time with her husband, daughter, and pup, traveling, reading, and making ice cream. So welcome.
Okay, tell me a little bit about this setup. Am I supposed to be on camera somewhere and paying attention to a remote audience, or does this come down and transport me somewhere?
The camera is
okay, so I can move around and no one will care. Okay, good. And then where do we move slides? Oh, clicker. Yes. Connor is already aware, Connor Hanrahan that I work with, that I am the death of most electronics. So we'll see if we can make this work. So I don't have any really relevant disclosures, but do want to disclose that I'm a pharmacist member of the Utah Board of Pharmacy. Been on that board for 7.5 years. So I have 6 more months and then I'm done with the board. And I wanted to talk a little bit more about what is health system pharmacy. And honestly, I've worked in health system pharmacy almost my whole career. I actually started in pharmacy at a small independent pharmacy early as a pharmacy technician. And so still deep in my heart, I love independence. There's Jeff. Go, thank you. And then earlier in my career, I switched over and started working in retail pharmacy at Intermountain Health and went to pharmacy school and then started to realize there was more that Intermountain owned than that little pharmacy I was working at. And continued on into hospital, and I've had many jobs but one employer with Intermountain. So health system pharmacy is often a larger component and has lots of different services to provide to patients. And health system pharmacy, I think, can look really different in a lot of different areas. Certainly in Utah, the health systems are more consolidated, and you see Intermountain Health and the University of Utah Health System. Then you also see things like, I don't know if they've been merged a couple of times, but the system HCA that has St. Mark's and some of those health systems as well. When you're looking at health system pharmacy as well, there's often two designations, one that is not-for-profit and one that is often for-profit. And you'll see in larger markets, a larger mix of all of those. And certainly in Utah, there's a higher predominance of not-for-profit health systems. Doesn't necessarily mean that they're not in it to have enough money to operate and then also to have enough money to grow and expand. It just means that they're not paying a different shareholders, and they're not on the stock market. They may not have owners. And in fact, in the case of Intermountain Health, it was donated to the community. So truly, you are all owners of me at Intermountain Health. The community owns Intermountain Health. Was donated by the Church of Jesus Christ of Latter-day Saints, which is often a theme we see. And Intermountain Health also has some hospitals in Colorado that were donated to the community by a Catholic system that had owned them prior. It's definitely a theme you see as you go through hospital systems, that they're now moving into more of a business than a religious-owned environment. So the not-for-profit health systems will just have a little bit of a different spin, but oftentimes they're very similar to these for-profit health systems. Certainly with USHP, we have a national parent association, ASHP, and they tend to look for more of the advocacy efforts that will pertain to these health system pharmacies, but truly pharmacy is very similar no matter where you go. And so we'll have different spins on things that are more important to each other, and oftentimes some of those things may be things like 340B. So if any of you get an opportunity through school or through some of your rotations to learn a little bit about 340B, that'll often impact these larger health systems as well, more so than maybe other organizations. When I look at advocacy from a health system perspective, I may switch hats during this presentation a little bit. I'm here to represent USHP, and yet I have a lot of experience in this large health system arena, and I have experience as a leader in a large health system, and so you'll see a little bit of that spin from me as well. One of the main things that you can do, and I'm sure this has come across as a theme through all of these presentations, is to make sure that you follow the legislature. Get on there and learn a little bit about the website. You can go in and track bills and create your own bill tracker, and it'll send you little updates for the bills. You can go to your legislators' town halls. This is something that you need to get on their email list to get. And it seems like sometimes in the legislature, we'll have legislators that have little niches. So for example, the senator that's in my area, he works in education, and so a lot of these education bills are what he'll follow. So sometimes I will join the email list of people who don't do that. I might not even be in their district, and I may follow some of what they're doing through there. So it doesn't necessarily mean that you have to be in their district. The other thing you can do is go to your caucus every year. And I put some links in this. I don't know if she's sending out this presentation, but if you've never been to your caucus, it's kind of a really interesting thing. I actually remember my parents were pretty involved in government, and it used to be that before the legislative session every year, somebody would hold the caucus in their house. Probably was Adam Jones's house, not really. It was your dad's house. I used to live across the street from Adam Jones's dad. So in the case of in South Jordan, since I live here, and maybe some of you do, it is a Bingham High, and they bring several different caucuses, and you come together and you vote for a delegate. And I just showed up blind to my caucus because I'd been with my parents before and thought, I'm just going to go figure this out. Next year, if you haven't done it, I think it's something you should do at least once in your life for sure. If you really need instructions, don't call me Adam, I'd have to tell you. Yeah, I usually go there and find Adam Jones's dad, and then I know I'm in the right place. That's how I roll. There's also an ASHP advocacy agenda that you can look at on the ASHP website and follow a lot of those. They will follow a lot of the more national issues, and that's really helpful to help kind of keep the pulse on what's going in other states. And being on the Board of Pharmacy, I find a lot of what we do is listen to what's going on in other states, and all of the states do this. So being on the Board of Pharmacy, I've been able to go to NABP. NABP is another organization that you could follow that will help you keep track of some of what's going on. On the board, I've really loved it when people have come to us with ideas for legislation. Maybe they heard about them in another state, or they just see a problem that we need to solve. You can build relationships with the lawmakers in your area, and certainly call them when something comes up that's pharmacy related that you feel you want to give them your opinion on. That is their job. I have had mixed results when I've called my representation for the legislature. But to be honest with you, I don't care. That's their job. They're representing me, and I am a pharmacist and may feel like I have a different perspective to give them on healthcare legislation. And so I just encourage you to be brave doing that. They all have email addresses. Oftentimes they have staffers. But when I do send any of those things to them, I tell them I am a pharmacist. The one thing I don't do, because I'm a health system pharmacist, is I don't say, here's where I work and I represent this company. Because most of the time when I'm reaching out on a personal level at this stage. So you can reach out to lawmakers, and sometimes they'll get to know you. And maybe they'll realize, oh, I do have a constituent in my area who does care about this, and they may get to know you and recognize your name. You can also connect with the Utah Board of Pharmacy. Our Board of Pharmacy meetings are every 4th Tuesday. Starting with next Tuesday is our next one. Just some quick pearls from a health system leader, essentially. You, in a large health system, will usually have a government affairs person. And you as an employee of a health system really can't represent that health system when you want to communicate. But you can represent yourself, and that's always great representation. And you can even say, you know, I work as a hospital pharmacist. You just don't identify which one if you're not representing your company. You can identify for your company sometimes patients or professionals that may have stories to tell. When you go to a lot of these meetings, the stories are super compelling. And I'll tell you honestly, there was a bill I worked with a legislator on a couple of years ago that was sponsored because my cousin called me, and it'll choke me up. My cousin called me because his son, his 17-year-old son was dying of cancer. And as he switched him to hospice, he got a prescription for oxycodone or OxyContin, and he had a super hard time getting it filled. And he was struggling with these last days of his son's life, and he called me and said, I shouldn't be fighting with the pharmacy to get my son's prescription. I can't get my son's prescription, and I have such a limited time with him. We got a legislator to sponsor a bill. My cousin went before the committee and told his story. Honestly, there was not a dry eye in the house. We got that bill passed. We haven't been able to implement it because of some of the technology challenges with TransferRx. But those kinds of things are really good examples of how an individual can bring a bill to pass. And you could do this too. You may have patients or family members who come to you with challenges, and these are how things progress and get better. So, and there may be times in your company where there may be legislation that they're really interested in. you as a pharmacist be willing to go speak for that legislation. They'll usually have a government affairs person who will prep you, and that's really helpful, and it's a good way to get your feet wet with professionals. So just so you know, look up your legislators. These are mine, and they hear from me often. So they're definitely in this role for that reason, and I just wanted to put that up there for that example. It's super easy to find. Want to turn this over to Emily.
Thanks, Carrie. Awesome. So I'm going to, oh yes, that's important, talk a bit more about pharmacy advocacy in Utah. I'm sure it's similar to some of the things that you've heard, but kind of my perspective on it and then some examples that I've been able to experience. So in Utah, I think we're lucky where we have a few different organizations. We have USHP, we have UPhA, and you heard from Adam. And we do work with the goal of really closely together to represent our pharmacy community here. Pharmacy community meaning our pharmacists, our technicians, our students, our patients, whatever that may be, working together in our collective best interest. And a lot happens in Utah within the short legislative session. You'll hear from Senator Vickers, but it's really only a few weeks long. And they have hundreds of bills, maybe even 1,000 bills that get proposed, hundreds that get passed through. And so with that, there's a lot of behind the scenes work that happens. There's a lot of preparation before the legislative session, where if you have things on your mind, like Carrie mentioned, reach out to your representative, to your senator to talk about those things so that when the legislative session comes around, you're ready for those things. And of course, we need more involvement from our students, from our technicians, from our pharmacists. We see a good group here today, but there's a lot of more people that aren't here, right? So as we're working on these things, just reaching out to those that we work with, those who may have an interest in some topics that come up, whether it's a bill that's coming up, whether it's a topic that you feel like needs change, just engaging those that you work with, that you interface with, to be more involved. So with that, I'll just touch briefly on what USHP does as an organization in our advocacy committee. We're a small but mighty group that I think work really well together. And this is just our vision and our goals that we have in our SOPs that you can read through, but with the goal of developing an ideal practice model for our patients and our population, optimizing population health, advocating for advancement of pharmacy practice, and collaborating with others. So with that, our advocacy committee, which we invite you all to join, I think it's very low cost for students to join USHP as an organization. We meet every week during the legislative session. We had our first meeting, is it yesterday, Tuesday? The Monday holiday just throws me off. But talking about what types of bills are coming up, it's cool because we have a pretty diverse group on those calls. That work within health systems pharmacy, but in different areas. Like yesterday on our meeting, we had someone that works in 340B. We have someone that works in psychiatric pharmacy. So that there's kind of those different experts that as bills come up on those different things, they can focus more on those and provide a really good opinion for us there. And we have a bill tracker that's sent out that's on our website that we look at internally. And this is kind of an example of what it looks like. Just so we can keep track of the pharmacy, healthcare related bills that come up throughout that short session. And then throughout the year, we work on different initiatives that are proposed either nationally or locally, gather ideas from the pharmacy community. Over the last couple of years, we've done things like there's been CMS funding for PGY1 programs being kind of a hot topic. So we worked with ASHP and writing a letter on that. And then, as you heard from Nevada, the MPJE exam's been another hot topic nationally. So just gathering data and opinions internally through our board and then looking to take that outward going forward, just looking at that. So there's more to be done throughout the rest of the year, but really the bulk of what we do on our advocacy committee happens during the legislative session. So I see Senator Vickers on the screen here on Zoom. I got to intern for him during the 2022 legislative session as one of my pharmacy rotations. And it was like easily one of the highlights of pharmacy school for me. It was super cool to be up there with him, to learn from him as a pharmacist and as a legislator in our state, to see the different types of things that our legislators do for us. As Carrie mentioned, her senator works in education. What's really cool to me in Utah is that all of our legislators are part-time legislators. And they have full-time careers and full-time families and full-time community involvement that they do for most of the year. And then they all come together during these brief few weeks to make things happen in our state, right? So it's cool that you have Senator Vickers as a pharmacist and his own pharmacies and whatnot. You have physicians, you have educators, you have all these different people that are really experts in different areas. That also means that they're pretty normal people, right? I think Adam's always wanted to say that the legislators put their pants on the same way we do, one leg at a time or something like that. But they really are normal people. They want to hear from us. And because they're not maybe healthcare experts, when bills come up about pharmacy and different things like that, it's really an opportunity for us to reach out to them. Like Carrie mentioned, I think as we're looking towards the legislative session, something you can do if there's something important to you, you know, say, I am a pharmacist, I am a pharmacy student, I am your constituent. Give them reason to why you're voicing your opinion. I think a lot of times form letters will get put through, and those are not as meaningful for the legislators. In fact, I remember going through Senator Vickers' email box with the other intern, and he's like, well, watch to see where they're from, what they're saying, you know, because you can't read every single email that comes through, unfortunately. So just as you're reaching out, making sure you're brief, making sure that you state who you are, and then why and what your ask is, with kind of an action item there, whether it's, I think this way because such and such, I would like you to vote this way because such and such, or whatever that looks like. So, you know, as we said, that I think there's a lot of good that we can do, and we'll start seeing those pharmacy bills. I saw Adam's tracker that he passed around. We'll start seeing more and more build on those. If you have questions about where to look for, like when committee meetings are or whatnot, please reach out to me. I'm happy to look at it with you, just so you can learn that better and be involved in the process. With that, there's my quick talk presentation, and thanks to Carrie for talking more about health systems pharmacy. I think we have like a minute or two left, so just any quick questions? Okay, sounds good. Oh, Jenny.
So if anybody wanted to join the advocacy committee for USHP,
Wow,
how would they do that?
question. So you do need to be a member of USHP, which I think student membership is at like $10 or yeah, something like that. Talk to Jenny and Connor if you're worried about that. And then reach out. I think it's advocacy@ushp.org is our email. And I know that gets forwarded to my email box. We need to make sure it starts getting forwarded over to Carrie's email box. But we'll see that if you're interested in getting involved. And then we'll add you to our weekly Teams meetings, which are going to be Mondays at 5:30 p.m. throughout the session. Okay, what other questions? Yeah. Nothing has happened yet. And I don't want to take too much more time. We can chat more later. And I think Carrie and Jenny and those guys will have more opinions and input than I have. But I think it's still kind of in a collect opinions, figure out what's happening nationally. Nothing has, that I know of, formally been brought to the board. So you might still have to take the MPJE. Cool. Okay. Yeah.
Thank you so much for taking time out of your busy schedules to come down. It's been a really fun night, learning about all sorts of things. And I am super excited to introduce our next speaker. I'm going to do some switcheroo-ski over here so you can see our screen in the classroom. We have Senator Evan Vickers on the line. I would like to formally introduce you, Senator Evan Vickers. He was born in Panguitch, Utah, and raised in Beaver, Utah. He attended the University of Utah College of Pharmacy and graduated in 1977. He and his family live in Cedar City, Utah, where they own 5 businesses, in addition to one in Richfield, Utah. Senator Vickers has been named Pharmacist of the Year by the Utah Pharmacists Association. In addition, he was awarded the NFIB Utah Small Business Champion of the Year in 2006, as well as the Small Businessman of the Year and Lifetime Achievement recipient for the Cedar City Chamber of Commerce in 2022. Senator Vickers was first elected to public office in 1987 and served on the Cedar City Council until 1999. In 2008, Senator Vickers was elected to the Utah House of Representatives, where he served for 4 years before joining the Utah Senate in 2012. He served as the Senate Majority Leader from 2019 to 2024. He serves on the Iron Mission Foundation Board, Cedar City Downtown Parking Authority, and the SUU Levick Center for Politics and Public Policy Board, the Intermountain Desert Region Board of Trustees, and chairs the Utah Medical Cannabis Governance Structure Working Group. Senator Vickers has worked to improve Utah communities by passing legislation to reduce governmental regulations on small businesses and increase the strength of Utah's economy. He has also championed rural southern Utah issues, and Senator Vickers is an avid golfer, hunter, and fisherman who loves spending time with his family at their cabin near Panguitch. He and his wife, Chris, have 5 children and 15 amazing grandchildren. As a lifetime resident of southern Utah, Senator Vickers is honored to serve the people of District 28 and continue finding solutions to problems facing his constituents. Welcome, Senator Vickers.
Wow. That sounds like I'm more important than I really am, but I just noticed too, Emily had that picture up of she and I on the floor of the Senate. I just realized I got the same tie on tonight. I think the same jacket that I had in that picture. So I don't know if that says anything, but I guess if nothing else, it still fits. So I guess it's okay. Certainly a pleasure to be with you tonight, and I appreciate, and I always appreciative of pharmacy students and pharmacists that are passionate about advocacy. And I tell people this all the time, any time that I've been involved, and I've been involved with pharmacy advocacy for a long time. Before I got into the legislature, I was on a national pharmacy board. We represented about 3,000 independent pharmacies across the country, and I chaired that board for a couple of years. And through that, I got involved in advocacy and learning more about how to be involved in working with legislators on all levels and on pharmacy issues. And I tell people, I said, quite frankly, if you don't want to be involved in politics, you probably ought to get out of pharmacy. And the reason I say that is that we're in a highly regulated profession, and I kind of joke with people, but it's really not a joke. I mean, you think about, so we own retail pharmacies, but if you think about it, we can break 16 or 17 laws in the morning before we open the doors because we are so highly regulated. So we're going to continue to see that in our world. And if you don't want to be involved in how those laws and those regulations are shaped, then somebody else is going to do it for you, and I guarantee you're not going to like it. So you really do need to be involved and participate. And I really appreciate Carrie and Emily, talking about their organization. And I heard that Adam was mentioned, with the Utah Pharmacists Association. And I see Sarah online. Sarah did a pharmacy rotation with me, up here in the legislature. And that's a unique opportunity, by the way. Dr. David Young and I started this from the University of Utah, started this when I got into the legislature, especially when it really started when I got into the Senate. And so this is my 17th year in the legislature and my 13th year in the Senate. And when I got into the Senate, we decided to try something different. And the rotations don't line up exactly with the session. But and I do have an intern every year that comes from one of the universities, and I've got a great intern this year, Abby, who's with SUU, because I live in Cedar City, and so typically I do have an SUU intern. But I also try to have a pharmacy student. We always have a pharmacy student that comes in, usually the back half of the session, and that's kind of how the rotation kind of lines up. and he and I share that student as, and, doing the rotation. He's the lead preceptor, and then I kind of borrow them for that last half of the session and try to give them opportunities. I know with Emily and Sarah both, I gave them opportunities where they could actually manage a bill and see it through all the way. And I think that was a good experience for them. It certainly was unique. And Dr. Young and I have looked into this, and as near as we can tell, it's the only rotation of its kind in the country where you have a pharmacy student working with a pharmacist who is a legislator during a legislative session. And like I say, we always try to find some unique thing, new perspectives, help get involved in some healthcare issues, and also work with my traditional intern and working through and just seeing how the day-to-day workings of a legislator works. And so it's a good opportunity. Last year was the first time we'd had somebody from Roseman, Ashley Glasner, did a rotation. She actually came in the first half of the session, worked out pretty good for her. She came in the first half of the session, then had a pharmacy student from the U in the back half. And so it's a great opportunity. And if somebody out there, if one of you are out there and are interested in something like that, let's get together and see if we can make it work. But I do want to talk to you about the profession and the need for advocacy. As I mentioned, we are highly regulated. And let me kind of give you an example of why you need somebody with knowledge. And if you haven't already figured out, when you're trying to explain pharmacy issues to people that aren't in the profession, so a lay legislator that's not a medical professional or a pharmacist, trying to tell them about 340B medications, or trying to tell them, about brown bagging and white bagging, and talk to them about PBMs and the issues we face with PBMs and other things. It's a foreign language, and it's really, really hard to try to tell them and explain to them the inner workings of how that works. So I would highly encourage you to be an advocate for the profession. So how can you do that? And I like to say, that you need to develop relationships. Okay. And so what does that mean? So, well, the bottom line is you need to communicate. And I heard that Emily and Carrie were talking about, communicating and how to communicate with a legislator. And she mentioned, form letters. Well, that's the number one rule. Never do a form letter. A lot of advocacy groups for various different things will send you a form letter and say, here, send this to your legislator. Well, those, number one is we're looking to see if it's someone from my constituency, so my district, number one, and number two, if it really says anything. And guess what happens if they're not? Typically we just don't look at them and maybe even hit delete. We've had an issue here on the Hill yesterday and today, and a bill that was in a committee that I chair. It didn't have anything to do with pharmacy, but we were getting lots and lots of emails about it. Most of those emails, in fact, I think all of those came from outside of my district. I had one from my district and everything else came from outside the district. And they all said the same thing, and so you read one of them and that's it, then you're done. And so try to be short and concise, always be respectful, always be respectful, always tell, who you are, where you live, and what your background is and what your issue is. And then be short and concise, try to get to the point. If it's a particular bill you're talking about, explain that bill the rest of the way you understand it. If there's a specific area of the bill, language or something that you disagree with or agree with, say that. And then be respectful of the legislator and offer to be a resource for them. You can do that. You can find emails. I know that Carrie showed you that she's gone on the locator on the legislative website and found out who her state senator and state representative was. You can do that. I hope all you do that if you haven't already, and communicate with them. spend time, and really as a student, it's really important, I think, that you spend time up here on the Hill, especially on Pharmacy Day on the Hill. And Adam told me when that was, and I've already forgot, but I know it's coming up. But spend some time up here, and I'm plan to try to meet with your legislator, and we do. We especially want to make efforts to meet with everybody that would like to talk to us, and so most all of us up here are open to that and do that, and try to meet in person. Other things you can do is invite them to your practice setting. Invite a legislator, typically it'll be in the off season. So maybe during the interim here in Utah, when we're not in session, or a congressman or a senator when they're coming back from DC and when they're in the district and not burdened with meetings, invite them to your practice setting. You'd be amazed what you can find out and what they can find out when they come to your practice setting. And I will say, I got a close friend that I served with. He's from Oregon. He's a pharmacist from Oregon. And we served together on that national board that I mentioned. And he always said that he had a relationship of 5. And so he said, you need to develop relationships with 5 people if you're going to be advocating for your profession. And so who do you think that might be? Well, your state representative, your state senator, your 2 US senators, and then your congressman or congresswoman. And how do you develop those relationships? So that's a little different. They're in DC now, but they still live in the state. So there's an opportunity. They may live in your district. They may live in your area. And if that's the case, invite them to your practice setting, set up a meeting. And if you decide you want to try to do that, get with Adam, because Adam, and Carrie and Emily, they've got groups to do that on a regular basis, invite legislators to practice settings. You can do that. If you ever get an opportunity to go to a conference in DC, set up an appointment, go meet with them. Typically, you're going to meet with their staff. And but you need to develop relationships with the staff just as important as the legislator themselves. And so and then become a resource. Before I got involved in the legislature, I actually did that. I reached out to my legislator and I went to a couple of conferences. And so I got to meet him. It was Jim Matheson at the time. He was in Congress and representing Southern Utah where I live. And so I kind of developed a relationship with him and with his staff and put myself out there as a resource. And I got a call one day, and it's from his staff person, and said, "Hey, we've got this issue coming up before us in our committee. What do you think about it?" And I knew that I'd hit a home run when that happened, because he had actually been in my pharmacy. He had we'd talked on the phone, we'd talked together. One day I got a call from him and he was explaining something to me. So, it works. You can do it and it works. But develop those relationships, and you don't have to be best friends and go out to lunch every week or something like that, but you can still develop that interaction and relationship so that when these issues come up and when you speak, you have an impact, and oh yeah, I remember that person. I do remember I've met with them or I was in their pharmacy or something, yeah, I need to figure this out. And those are key things as you go about this. And then I will just tell you that I hope that the profession treats you as well as it has me and our family. Our family, we've got 5 kids, as mentioned, and we have 15 grandkids, and we actually have a great grandchild now, and we're working on 16 grandkids. So, we've got kind of a legacy there. But all 5 of our kids grew up in the pharmacies. We own retail pharmacies, and they all have been pharmacy technicians. 2 of them have gone on to be pharmacists. They went to school up at the University of Utah, and they have now actually bought out my wife and I's interest in the businesses. I still do their bookkeeping for them and stay maintained with their central bookkeeping and things, but they've come down and taken over. But I just hope the profession treats you as well as it has us. It's been so good, and I can tell you that I would not be sitting here in this office in the Capitol if it wasn't number one for my education. and really my profession too, because my profession, I've found throughout my life that my profession, people respect my profession and our profession. We still rank pretty high, on the Gallup poll of most trusted professions. We're usually 2 or 3, right there. And I kind of always joke that I'm 2 or 3 with pharmacy and I'm dead last with politicians. So I guess I average somewhere in the middle. But you gain respect through that. And so I think, this is just a kind of a personal belief of mine, I think we need to give back and we need to leave the profession better than we found it. So what does that mean? Well, number one, help those that are coming along behind you. Help students who are thinking about, find ways to be advocates, just like Emily and Carrie are doing, here. And I know Sarah does as well. They work with students, they work with young pharmacists, help those behind you. And then also be respectful and give back in different ways. Number one, give back to the people that got you where you're at, whether that be your family, whether it be the institution where you went to school, like in this case, Roseman or the University of Utah, the college, and also your community, because no matter what community you move into, you're going to raise the average salary of that community. It's just a fact. And so give back to your community, and you can do that in a lot of ways. I mean, you can do it through your church affiliation. You can do it through, coaching Little League baseball or dance or, those types of things. You can get involved in the political process. You can, help. You can, in Cedar City in particular, there's all sorts of committees, civic committees that you can serve on, from the library board to the airport board, to the water board, to recreation, you name it, there's a board, there's a community board that you can serve on. And there's all sorts of other opportunities as well. And so those are some of the things that I've kind of found in my, as I've gone through the profession. It's treated me well. It's been challenging at times. It seems like literally when I started into pharmacy, it's long ago. And, when kind of pretty well dates me when I say I graduated in 1977, that was a long time ago. I literally, when I started in pharmacy, I had a counting tray and a manual typewriter. We did not have computers back then. All the patient records were done by hand if there were any. I remember when I was working for Albertsons at the time, when we got our first computerized system. We didn't have insurance cards that people would pay cash for their prescriptions and then they would submit their receipts to the insurance company. That's all changed, and so I've seen massive changes in the profession. Back when I graduated from pharmacy, I really had just 2 opportunities. One, to be a retail pharmacist or a hospital pharmacist. Pay was terrible. My first job as a licensed pharmacist was $7 an hour. Now we're paying over $65 an hour for our staff pharmacists, in our businesses. So it's drastically changed. And I've seen lots of things that have transpired that, both good and bad in the profession, but overall it's been a lot of fun and it's been rewarding, at least for me it has. And I hope it is for you as you go forward. So I don't know, I've actually got to run to another event, but I've certainly, is there any of the questions that you'd like to ask or anything that I can answer in that way?
I do have a question.
Hi, Senator Vickers. It's Katie Gilmore from University of Utah.
Hi,
I'm
Katie.
just curious how you knew that you wanted to go into the Senate from being transitioning from your profession as a pharmacist to moving into the Senate.
Oh, good question. It was mentioned, I actually served on the city council in Cedar City for 12 years. And then I ran for mayor and actually got my butt kicked. I really lost bad. I actually ended up running against the former president of SUU, the university down there. And but I tell people this all the time. I won by losing. And you literally in politics, you can win by losing. And we had a very cordial campaign. We came out of it friends. Later on, he supported me in doing, running for the House. And then I kind of came out of that knowing that I wasn't done. I had a taste for it, but I wanted to pick and choose where I went. And so the opportunity for the House came up and I ran for that and won. Spent 4 years there. I won't tell you all the details, but I had some really nasty primary elections over my course working in the Senate. But I've enjoyed the Senate. I enjoyed my time in the House, but I've thoroughly enjoyed my time in the Senate. It's been more effective. There's smaller numbers, and I've had this wonderful opportunity to serve in leadership the last 7 years. But it all kind of started when I was in school at the U. I was in pharmacy school, and they came in one day and says, "Hey, we need a representative for the college to go serve in the university Senate." And I was literally the only person that raised my hand. And I was up against kids from East High and Highland and Skyline that had debate for 2 or 3 years. And, I got through it. I learned a lot, but that was my first taste. And I thought, that maybe. I mean, I wasn't completely sold, but it was a taste and got me started. So anyway.
So fun. Any other comments? Thank you for your time. We don't want to steal any more if you've got somewhere to be, but thank you so much for logging on and giving us some insight on advocacy and your involvement up at the state capitol.
Thank you, and I hope to see you all up here on the Pharmacy Day on the Hill.
Thank you. Awesome. We're almost done with the evening. We got just a couple more speakers left. I don't believe, Jeff, do you have slide deck? Did you have a slide deck? Okay, wonderful. So let me introduce our next speaker. And then we also have one immediately following that has joined the line. So if you guys are okay with it, instead of waiting, we're just going to keep rolling with it. Sound good? Got all these awesome people here. Okay, so is it Gatzemeyer? Yes, okay. He graduated from the University of Utah College of Pharmacy in 2006. He was the 2009 Pharmacist Mutual Distinguished Young Pharmacist Award recipient. In 2010, opened Oker Mountain Pharmacy in Magna. In 2017, received the McKesson Leadership Award and was president of the United States, right? Huh? Woo! Heck, wouldn't that be fun? President of the Utah Pharmacy Association. 2023 UPhA Pharmacist of the Year Award recipient, 2024 Pinnacle Award recipient from AlignRx, and then 2025 the President of the Utah Pharmacy Association for a second term. Welcome, Dr. G. Is this okay?
Okay, I'm pretty informal. I'm just a retail pharmacist. I'm an independent pharmacist. I own my own little pharmacy with my sister, who's also a pharmacist. I've been involved for a long time with UPhA, with the Utah Pharmacy Association, and so they asked me to come speak to you a little bit about independent pharmacy and about advocacy from our side of things. I actually did a rotation in my last year of pharmacy school with an independent pharmacy down in Utah County called Taylor Drug. It was owned by two brothers. One of the brothers was in my class at the University of Utah, and so he's a pharmacist as well. And so he was a good friend of mine and convinced me to go do a rotation with his pharmacy. And it lit a fire under me, and it kind of inspired me and changed my career and changed my life. And so, just get a quick poll. How many of you are P4s or P3s, depending on what school you go to? How many of you are in your last year? One. P2s? P1s? Okay, good. So we have a good mixture of everybody. So as you continue on with your education, as you start getting your rotations lined up, just know that those rotations really can change your entire career. Because at the time I didn't think I was going to try to own my own pharmacy, and I went down there and I did a rotation there, and they kind of planted some seeds with me, and ultimately I thought, hey, I would love to do this one day. I'd love to do my own thing, and if I ever have that opportunity, I'm going to try to take advantage of it. So I graduated from the College of Pharmacy at the University of Utah in 2006. I worked for Harmon's for 4 years. I was on a contract with them. And then at the end of those 4 years, I had an opportunity to open my own store. My intern who worked for me at the time at the College of Pharmacy there was a clinic out in Magna I don't know if any of you have ever been out to Magnets, really far west. You just keep driving. But anyway, there was a clinic out there. They were building a new building and they wanted to have a pharmacy be part of it. So they wrote a letter to the College of Pharmacy at the time and said, hey, if you know of any pharmacists that'd be interested, pass our information along. My intern brought it to me because he knew I kind of had a passion and I wanted to look into something like that. And so I went and met with the doctors out there and I went to my sister and said, hey, you want to do something crazy? And she said, yeah, let's do it. So we opened our first pharmacy in 2010. We've been there for 15 years now. We've opened a second pharmacy now, so we have 2 locations, one in Magna, one in West Valley. It's been amazing, and I love pharmacy, and I love being involved. I'm passionate about it. In fact, my technicians always tell me they know when I start talking about advocacy or pharmacy or legislation or PBMs because I always get really loud, and I probably talk fast too. So. Anyway, a lot of what I wanted to share today has already been shared with you. Advocacy, a lot of the different, the different groups already kind of presented a lot of the advocacy pieces. But real quick, I want you to take just a minute and think about your possessions, what you own. I want you to think of the most valuable thing that you own currently, okay? And it may be a house, it may be a car, a lot of your students, it may be an iPhone, it may be a car, I mean, those kind of things. You think about what you own that's the most valuable thing you own. For most of us, we pay additional money to insure those things, right? If we own a house, we don't want that house to burn down. If we own a car, we don't want it to be in a wreck. If we own an iPhone, we don't want the glass to be cracked on it, whatever. We pay additional money because we want to make sure we insure that value. Well, in 1, 2, 3 years, you will all graduate. Your education, I think, will become the most valuable thing you own. And that will lead you to a license, right? A pharmacy license. And that license will provide you with a career, with money, with opportunities. That license will become the most valuable possession you own. It's more valuable than a house because ultimately, if you buy a house, you're using the money that you got from your education to fund it. And so, a lot of us, we don't want to have our licenses become less valuable or meaningless. And that's why I think advocacy is so important for us. Every year, we face a number of different regulations and laws that can come in and take that away from us. And the last thing you want to do after you've sat through school here, school at the U, wherever it is, for 3 or 4 years and gone through all the assessments and passed all the tests and studied for all the all those things, the last thing you want to do is have somebody come in and take that value away from you. And if we don't go in and fight for it, nobody else is going to. And the truth is, I've found over the years as I've been involved with the Utah Pharmacy Association that every year there's threats to what we're doing. And every year we're hanging on for dear life just to make sure that we can keep things going. I listened earlier to some of the presentations about different things we're trying to do on the pharmacy front to expand our roles and to expand what we're doing. And that's great. I mean, it's awesome to open up new opportunities and new things that we can take advantage of and new ways that we can help our patients. But we also need to be paid for those things. And up until now, we've had a really hard time finding pathways to get reimbursement. So, it's great if I can prescribe birth control, but why don't I get paid for that when somebody else does? And those are the kind of things that I think we need to be, mindful of. And as a business owner, I think I'm hypersensitive to it, right? Because at the end of the day, I want to pay my technicians, I want to pay my pharmacists, I want to pay my rent, my lights, my heat, my bills, and there has to be money to do that. And Senator Vickers mentioned that now we're seeing pharmacists get paid $60, $65 an hour. Well, the sad truth is when I graduated from the University of Utah, I worked for Harm as my first job, and I was getting paid close to 60. That was in 2006. Here we are, fast forward, we're in 2025, and pharmacists are making relatively the same amount of money. And that's not right. I mean, it's not fair. And I think if you look at almost any other profession over that time frame, people would be shocked if that was the difference between the pay I received when I was my first job. I was so excited. And now you fast forward and it's like, we don't have the clout and the ability to make those, to pay people what they should be paid and what they're worth. And that would be my plea to you guys is, I love that you're here. There's not a ton of us here, right? Small group. And obviously you're passionate about it or you wouldn't be here. You wouldn't be giving up your time on a night when you could be doing something else. So I would implore you, when you graduate, ensure your license by becoming involved. Now, whether that's with Utah Pharmacy Association, whether that's with USHP, whether that's with APhA, NCPA, I mean, there's different pharmacy groups, and depending on what type of pharmacy you go into, will probably dictate what type of group you'd want to be joined with. But I would encourage you all to make that a high priority. It's not a lot of money. If it's $100, I mean, when you're a pharmacist, as a student, it's almost free or it's very, very, very cheap. So get involved now, great. But when you graduate, commit yourself, hey, I'm gonna be part of these groups because I wanna be involved. I wanna follow what's happening to my profession, to my license. I wanna make sure that I know the threats that are coming against me. I wanna not just defend myself against threats, but I wanna go and expand our roles and expand the way we can do things and help to make sure that we have a career that will last us for 20, 30, 40 years, whatever it may be. The Utah Pharmacy, I joined the Utah Pharmacy Association's board of directors back in 2009. When I decided to open my own store, I thought, man, I probably should figure out what's going on in the world of pharmacy. When I worked for Harmon's, which is obviously a local chain, I didn't really feel like it was that important for me. And the truth is, that couldn't have been further from the truth. Even as just a staff pharmacist at a retail or a chain setting, all of the laws that are currently being passed will affect you, even though they don't affect you directly, as they may a business owner or somebody that may see it a little bit faster. The fact that, all of these things chip away at what we're doing and erode at what we're doing will affect all of us. If we pass laws that allow, doctors to dispense more medications, that takes away from what we're doing, and it takes away opportunities and jobs for pharmacists. If there's laws that say, hey, we want to reduce the cost of medications, and the way to do that is to allow technicians to check prescriptions. Maybe you don't have to have a pharmacist there. Well, I mean, that's a problem for us, right? I mean, we need to make sure that we show our value and that we fight for our value. UPhA, I can speak to a lot of the things that UPhA has done over the last little while. Adam and I get to meet fairly regularly with a lot of different groups here in Utah to kind of get a lay of the landscape and figure out what's going on. We've met with Medicaid here in Utah a number of times. Right now, we're fortunate the director of Medicaid in Utah is a pharmacist. She was a pharmacist, and then she's been promoted up, and now she's the director of Medicaid for the entire state. Her name's Jennifer Strohecker. She's been amazing to meet with us. I think she understands a lot of the things that we're facing as pharmacists, and she's really, really open and willing to work with us. Some of the things we've done last year, I don't know how familiar you are with Medicaid and the way that the Utah Medicaid system is set up, but we have two different kind of sides to the Medicaid program here in Utah. We have the fee-for-service side, which is paid for by the state of Utah, administered by the state of Utah. They pay for anything that's related to mental health. So any medications for depression, anything for anxiety, anything for drug abuse or dependence, those are all paid for by the state of Utah. And then anything that's not related to those things, anything that's used for, any of the other, cholesterol, diabetes, blood pressure, those are paid for by separate companies called ACOs. Anyway, we're fighting hard as UPhA to try to make sure that the ACOs are paying a fair rate. Up until recently, the state of Utah, when we bill a fee-for-service drug, we're getting paid a NADAC pricing index. So NADAC is National Average Drug Acquisition Cost. It's a survey that's published. You can go online and find it. You can look it up. You can see what pharmacies are paying for any drug that's out there. What we're asking for as pharmacies is pay us fairly, pay us the cost that we're paying for the drug, and then pay us a dispensing fee for the work that we're being required to do by law. All the checks and all the counseling and all those things that we have to do cost money, and ultimately we should be paid for that. We're fighting PBMs like crazy. It's an ongoing battle. We felt like we had some momentum on a national level, didn't quite get there at the end of last year, but I think we'll see it again this year, and I think we'll eventually get there. Anyway, UPhA has been working really closely with Utah Medicaid to get those reimbursements at a level we feel is appropriate, and we feel like by July 1st of this year, we have a really, really good chance of seeing some marked improvement in that category. With We've also been able to meet with a lot of different representatives and legislators, not just on the state side, but on the federal side. We got to go to lunch a few months back with Representative Blake Moore and Celeste Malloy from two of our national, or I mean our federal side delegates or representatives. You know, I think there's a lot of good momentum right now in pharmacy, and I love that you know, we're starting to see some movement where we haven't seen before. But the truth is, if we don't keep going, you know, we need young pharmacists. We need you guys to come up and take what we've been able to do and push it further. And so I would highly, highly encourage you, think about joining associations, whether it's UPhA, whether it's USHP. Make a commitment now that you're going to continue to be involved, whether that's on a committee, whether that's on a board, whether you run and be president of the association. You know, it's really worthwhile. And you know, I can't thank Adam enough for everything he's done for me, help keep me involved and help keep me connected. And you know, I mean, again, like I said, I pay, you know, I mean, the amount of money you pay a year is pennies compared to what you want your license to continue to generate for you. And so, you know, I would tell you, you know, obviously the fact that you're here means you're passionate about it, means you have some desire to be involved, and I would encourage you. The other thing I would tell you is we need more Senator Vickers. You know, right now in Utah, we have one. We have one pharmacist who's up on the Hill, and he's been there for a long time, but he's not going to be there forever for us. And so we need to try to find and identify pharmacists who are willing and able to run for political office. And I would love to see, you know, pharmacists, young pharmacists start positioning themselves, going to caucuses, developing those relationships, building those relationships, and putting yourself in a position where we can, you know, get more support up on the Hill. Because once Senator Vickers leaves, if we don't have any other pharmacists up there, it gets a lot tougher for us. So anyway, I don't know if there's anything else. I mean, again, like I said, a lot of the things I wanted to talk about with you have already been covered. And so I don't necessarily want to just keep going over the same things over and over again. You don't need to spend any more time here than you need to. Couple other thoughts. Senator Vickers mentioned that we had a student from Roseman do a rotation with him last year. And it's actually our next presenter. She did a rotation with me last year for 6 weeks, Ashley did. And she was very, very passionate about advocacy and really wanted to be involved. And she really, really wanted to have a rotation with Senator Vickers. And so she pushed and pushed and pushed to try to make it happen. And Evan reached out to me and said, "Hey, Jeff, I would love to have her come do a rotation with me. But because it's during the session, it's really hard for him to keep up with some of the paperwork and some of the other things that go along with the rotation." So he asked me if I would help serve as the preceptor for her during that rotation, so that, you know, she spent most of the time, almost all the time up at the Capitol. She didn't spend a lot of time with me in person, but she'd just check in with me, you know, and we'd kind of go through some of the things she was working on and kind of go through it that way. But it was a really cool experience, and she put that together because she was passionate about it, wanted to make it happen. Well, Evan reached out to me this year and said, "Hey, are we going to have another student do that again this year?" And I said, "You know, I haven't heard from any of the students. I haven't heard from Roseman if that's something they still want to continue." He's, you know, Senator Vickers is totally willing to make that happen. And so if you're passionate about it, if it's something you're interested in, I'd love to be able to help facilitate that in any way I can. So if you're still looking at building out your rotations for your last year of school, something you should consider. I think there'd be nothing more valuable than spending, 6 weeks up on the Hill with Senator Vickers during a session and seeing the way it operates and seeing the way things work and being able to be involved that way. So I think that's a really, really cool opportunity. I wish it was something that was available when I was in school, because I think it's something I would have loved to have been part of. But again, I'm more than happy to try to help facilitate that from my side if that's something any of you are interested in. If any of you are still looking at an advanced community rotation, I have an advanced community rotation at my store through Roseman and through the University of Utah, both. So I'd love to have students come and be with me and look at different things as far as legislation, as far as the association goes, as far as a lot of the things we're working on. So I'd encourage you to come visit with me or come see me, and we'd love to get you signed up if that's something you wanted to come do. So any questions? I don't have a lot more than that, but really good.
Thank you so much. Can I take a sabbatical and join you guys on the Hill for a couple months? That sounds so fun. I hope you guys are writing this opportunity down and shooting Dr. Johansson an email as soon as we conclude tonight. Thank you so much. Any final comments or questions? It's been a really fun night. We've got one final speaker, and Dr. Glazner is on. So I'm going to go ahead and make some changes to the Zoom here. And then I'm going to give you a formal introduction, Dr. Glazner, just so the rest of the room, they've heard your name a couple times this evening, but I want to give some background. So Dr. Glazner is a dedicated pharmacist and a recent graduate of Roseman University just in 2024. With over a decade of experience in pharmacy practice, Dr. Glazner was the first Roseman pharmacy student to participate in legislative rotation with Utah's State Senator Evan Vickers. During her experience, Dr. Glazner delved into the intricacies of drafting healthcare legislation, contributed her pharmaceutical insights, and engaged with members of the legislature. This exposure highlighted the pivotal role pharmacists play in politics. Following graduation, Dr. Glazner began a PGY1 residency with the VA Southern Oregon Rehab Center and Clinics, where she demonstrated exceptional care by fostering meaningful patient relationships while addressing their unique healthcare needs. With a strong passion for care, Dr. Glazner plans to further specialize in managing chronic disease states and empowering patients through education and counseling. Known for her ability and passion for the pharmaceutical field, Dr. Glazner emphasizes continuous learning, effective use of primary literature, and collaboration with multidisciplinary teams to achieve optimal patient outcomes. Outside of pharmacy, Dr. Glazner is a devoted spouse and parent, balancing a fulfilling family life with professional growth. Dr. Glazner's long-term goal is to become a board-certified clinical pharmacist, working at the top of her licensure to impact patients' lives positively while cultivating the next generation of pharmacists and continued advocacy for the pharmaceutical profession. Welcome, Dr. Glazner.
Well, good evening, everyone. Thank you, Dr. Gundrum, for the introduction. It is nice to see everybody. I apologize, I'm not with you in person. I'm currently in Oregon, so many, many miles away. Jeff, such a pleasure. Thank you for the quick interjection. Just to kind of piggyback what Jeff had mentioned, I was the first Roseman pharmacy student to procure a rotation with Senator Vickers. Some of the things that kind of started this was my first day as a P1 on Capitol Hill. I heard about the opportunity to have an internship with Senator Vickers. When I had talked to Dr. Johansson about this, I learned that unfortunately, Roseman did not partake in that particular rotation. And so it was at that time that my wheels started turning, because I don't necessarily believe that just because you have a blockade that's your stopping point. So for me, one of the things that I did was I started to network. I started to utilize my advantages being in the field for as long as I have, 15 years, actually 16 years this year, and utilized my strengths to be able to get that rotation, hopefully. And so because I had demonstrated a professional attitude, an eagerness to want to partake in advocacy, when actually I wasn't per se even on Jeff's rotation, I was with his sister, Michelle, and just because of me talking about what it is I wanted to do and really mentioning this to Jeff, did we really kind of spark that relationship of, hey, maybe we can make something work? And Jeff was so willing to be able to assist me with that. And because of that and his relationship with Senator Vickers, I was able to become the first Roseman student to actually be on the Capitol Hill. My first day was January 16th of 2024. And for me, honestly, that was my Elle Woods moment. So for you, I know I recognize some of y'all's faces, actually the backs of your heads, because I can see the camera, but y'all know that for me, I think that a part of advocacy is hearing the word no and not just sticking with that and figuring out what your path is. When it comes to being a student, there are some roads that are not even paved. And I believe that in all of the speakers, you'll hear the same concept that they got there some which way, shape, or form. Now, take a step back and think about that. Not all of those roads were paved necessarily for them. They had to figure out how to lay that foundation and that ground for the next generation. And ultimately, I'm really glad and proud to say that I hopefully have laid a foundation for Roseman students to be able to continue on with that rotation with Senator Vickers, as well as with Jeff, because I learned so much. One of the bills that was actually just passed this past legislature, I had a helping with it. And so now every time I look at that on the Utah legislature, I'm like, oh, that was me. That was a part of me. Granted, my name's not on it anywhere. No one's going to know, but it was my pride and joy that I was able to facilitate that because of my expertise. Some of you may not have any sort of educational background or expertise in any field, but that's not necessarily a weakness. You can play that to your strength. And so for me, one of my biggest fundamental concepts that I want to leave with you as a student is just because it hasn't been done doesn't mean that it can't be done. And so your takeaway from this is that if you have an idea, figure out how to get it done. Figure out what your network is, because at the end of the day, that's what advocacy really is about. There are certain things that you've learned about today that a lot of pharmacists don't have prescribing powers, or if they do, they're not getting reimbursed for it. But that's not a reason to not continue forward and propel yourself into an arena that may be unfamiliar, unknown. And that's really what the pharmacists of this generation and the upcoming generation are really doing, is inspiring those to make those changes. For those, again, who don't know me, I speak up. And sometimes yes, it does get uncomfortable, but that is another strength of advocacy. And I don't mean speaking up in a bad way. It's about voicing your concerns, bringing this to caucus, bringing it, if you see something, asking about it. If there's something that can be done, talking with your legislators and really voicing your not just concerns, but maybe engaging them with solutions and opportunities for improving that. When I was on Capitol Hill as a P3 student, it really opened my eyes as to the engagement that the profession really allows for healthcare practitioners. To see how Senator Vickers engaged with not only his colleagues, but also with the, quite honestly, anybody. It was really eye-opening to see how humble, number one, he was, how engaging, and how much he really attentively listened to every individual. Those were some of the greatest takeaways that I gained from Senator Vickers that I really impose upon you, that utilize your strengths, strengthen your weaknesses, because at the end of the day, when it comes to advocacy, we really need you to continue on with this. And it doesn't matter that you may be a P3 and unfortunately, that rotation is not available to you right now. But for anyone who's a P1 and a P2 student, that opportunity is available. Jeff just mentioned that to you. So it may be frightening, it may be intimidating, but that's where you have the most challenges. And that's really a lot of the times where you find who you really are and really what you can do when you start to push those healthy boundaries. One of the other things that I have learned from being a student now as a pharmacist after graduation is that my journey on advocacy doesn't stop. I'm actually with one of the state programs out here, still helping in any which way, shape, or form that I can. I actually still have my certification out in Utah, which I actually plan on coming back. So you'll probably see more of me here in the next few months. But any state that you go to, whether it be Texas, Nevada, you can always engage in some which way, shape, or form. Especially now with social media and the presence of that, that's a good starting place. Start to network. As you heard Senator Vickers mention, he has a lot of connections. And so maybe that's an opportunity you can also speak with Jeff about. Hey, I'm going to this state. Who do you know? Who can I get connected with? Or how should I get connected? If you don't ask the questions, you're not going to get the answers. And sometimes you may not know what questions to ask until you start asking the questions. On really when it comes to being a student and after graduation, some of you may already have a residency. I can speak that residency life has been very challenging because your days and nights are mixed. You have not necessarily a balance of life, but that doesn't mean that you still can't be engaged. So I know that you've had, it's just kind of echoing what Jeff and Senator Vickers had mentioned earlier, a lot of engagement and interaction. I want to open this up to group and kind of have this, if you have any questions, I want to be able to help you maybe answer them, direct you to anyone that I can, or anybody questions? I know it's been a very long night. I wanted to try to keep this short and sweet because a lot of what I said or wanted to say has already been mentioned.
Any questions?
I don't bite, I promise. I'm many, many miles away from y'all.
Oh, we do have one comment.
Hello, my name is Katie. I'm with University of Utah. I am just curious if you'd be able to provide contact information just in case we wanted to reach out to you and connect further. If
Yeah,
you'd be willing to do that.
absolutely. Dr. Gundrum will be able to, she can give you my telephone number. I'm best at text messaging, as well as my email address, whichever you prefer. I'm available. If you need to get a hold of me, urgently, text message is the best way. So we can go ahead and give it to group.
Great. Okay, another question/comment.
Hi, how's it going? I'm Anthony P1 from Roseman. So just curious, what was the bill that you were working on? And that, so just wanted to know.
Yeah, so it was, golly gee, I think it was House Bill 52 is what it was. Ultimately it was just a change of telephone number. So the commentary that was actually on the bill was regarding the difference between a mail order pharmacy and a retail pharmacy. And it was the language that was associated with that the pharmacy had to have a toll-free number. And so ultimately what we did was we separated the language where the toll-free number was associated with the mail order pharmacy, whereas patients who had any sort of questions or consultation needs or anything, it was associated with a telephone number that could be met with the retail pharmacy.
Awesome. Cool. Any other questions or comments? How about, what did it feel like crossing over that graduation stage?
So it was surreal. I think that for me, as I mentioned, I am a mother. So for me, it was definitely a surreal situation because I've been in school for as long as I can remember. I guess ever since I graduated high school, I'd taken classes here and there, became a mom to two wonderful children. And I was actually the student chosen commencement speaker as well, which you can actually go on YouTube. I will forever live on YouTube, along with my best friend, Sarah Tesfaye, who was the student speaker the previous year. But for me, it was really a rite of passage that with blood, sweat, tears, and a few gray hairs that came out of it, it was my hard work to be able to hear my name. And I think that for me, it wasn't just the crossing of the stage that really inspired me, but to have Chancellor Wells call my name to be the only student mentioned as Dr. Glazner. That will forever live in my head and live in my kids' heads. And when you hear those words in front of everybody, it was a magical moment for me. And to be where I'm at now, everybody with my technicians are calling me the pharmacist, and I'm like, oh, who? That's me. It's still surreal. And I don't think I'll ever get out of that because, again, I was a technician, then I moved on to a senior technician, and for a few short years I was an intern. It's still hard to believe that I'm a pharmacist, but very magical moment for me, especially for my kids to hear that. I actually go by Dr. G, and my technicians got me a little pad, a notepad that says Dr. G on it. And on the back of it, it says, your favorite color is glitter. So they know me so well.
Thank you so much for joining us. I don't think we have any other questions in the audience. And so that concludes our advocacy night. Thank you, Dr. Glazner, for zooming in from the West Coast.
Thank you so much for allowing me to be here with you all. And last words of wisdom, y'all, is it's going to be hard. It's going to get tougher, but hang on. You may not see the light at the end of the tunnel, so turn on your flashlights on your phone and pave your own way, but you can do it.
I love that. Thank you so much. Awesome. Okay, so I'm going to go ahead and stop the Zoom here and just want to say thank you again to all of our speakers. Thank you to all of our students and pharmacists calling in from all over. It has been a really fun and informative night, and hopefully we're feeling energized for our day at the Capitol. Got some great information to put on our posters, thinking of questions to ask our legislators, figuring out how to contact them and figure out who they are and what they look like so you're ready to professionally attack at the Capitol. Okay, have a great night.